Hello, good afternoon, everyone. I'm Sin from ArtScience Museum. Thank you for joining us at Expanded Anatomies, Flesh and Bones opening symposium. It's a pleasure to see a room gathered around what is at its core a very fundamental question. How do we come to know the human body? And just as importantly, what remains beyond that knowing? And this symposium is organized as the opening program for Flesh and Bones, the Art of Anatomy. And it takes the exhibition as a point of departure to think more broadly about anatomy as a scientific discipline, but also as a field that's shaped by history, culture, and different ways of knowing. Across a keynote and 2 sessions of presentations, we will move through different registers of this question. We begin with the institutional and the historical conditions through which anatomical knowledge has been produced and authorized. And from there, we open into artistic and lived experiences and perspectives where the body is encountered as an archive that cannot always be fully mapped or measured. While Western anatomical traditions continue to underpin much of how bodies are studied today, this symposium asks how those frameworks are transmitted, adapted, and sometimes unsettled within Singapore and the region. And this program brings together medical educators, practitioners, artists, and curators to consider anatomy as a human practice that's always situated and always evolving. And to begin, it's my pleasure to welcome Harger, Vice President of ArtScience Museum and Attractions at Marina Bay Sands, to deliver the program's opening remarks. Honor, please.
Thank you, Zin. Good afternoon and welcome to ArtScience Museum for the symposium that launches a very special exhibition for us, Flesh and Bones, the Art of Anatomy. This year is ArtScience Museum's 15th anniversary, and we're marking this important milestone with a major new exhibition that brings together art and science to explore something that's universally familiar, yet endlessly complex, the human body. I'm going to take a few minutes to introduce the exhibition for you and set the stage for the afternoon's talks. Flesh and Bones, the Art of Anatomy, draws on the historic collections of one of the world's leading visual arts institutions, the Getty, alongside new research by ArtScience Museum. It offers a powerful encounter with human anatomy, tracing how it's been studied, imagined, and understood across cultures and time. At its core, Flesh and Bones shows how the intertwined practices of art and science have shaped our understanding of anatomy. The exhibition brings together more than 160 artifacts and artworks, ranging from anatomical illustrations, rare books and medical manuscripts, to major contemporary artworks from around the world. Flesh and Bones originated at the Getty Research Institute in Los Angeles in 2022. The original exhibition was curated by scholar and curator Dr. Monique Kornell, and I'm delighted that she's with us today to give the keynote for today's symposium. Our new version of Flesh and Bones includes 35 exquisite works on loan from the Getty, ranging from Renaissance drawing manuals to anatomical atlases, ranging from the 16th through to the 20th century. We are particularly thrilled to be showing large-scale anatomical engravings by Antonio Catani, produced in Italy in the late 18th century. These life-size illustrations are among the most accomplished visualizations of the dissected human body ever made, and having such masterpieces in Singapore for the first time is a rare privilege. In this new edition of Flesh and Bones, the Catani engravings are presented alongside contemporary works by the Hong Kong-based artist Angela Su. This juxtaposition is central to the thesis of the exhibition. This approach extends across the show, with contemporary art placed alongside historical work. It brings Enlightenment systems of anatomical knowledge into dialogue with contemporary artistic practice from Asia. The exhibition opens with a dramatic new site-specific installation by Japanese artist Chiharu Shiota. Using her signature red thread, Chiharu metaphorically depicts the human body as a system of circulation, inviting visitors to inhabit anatomy as a spatial experience. And you'll be hearing from Chiharu later today. We invite visitors inside the human body at the midpoint of the exhibition too, with a vulva, an immersive audiovisual artwork by art collective Marshmallow Laser Feast. The work takes visitors on a journey into the body, tracing the path of oxygen through the lungs. It unfolds across large-scale projections within the galleries, with a guided meditation narrated by Kate Blanchett and a soundtrack scored by Johnny Greenwood of Radiohead. And there's also a virtual reality version of a vulva at the VR gallery just across the hall here at level 4. This work is alongside 32 other contemporary artists from around the world, including pioneers of video art such as Bill Viola and Barbara Hammer, and radical media artists like Stellark and Orlan. Also on show are artists from Singapore who explore the body from a more personal perspective. For example, Yanyun Chen, Kray Chen, and Woong Teng, for example, address their own anatomical conditions with intimacy and courage, something Yanyun and Suk will speak about later today. For much of history, and still today, our most direct knowledge of human anatomy comes through medicine. Flesh and Bones addresses this with a collaboration with the Yanyun Chen School of Medicine at the Nanyang Technological University, showing how anatomy is taught and ethically practiced here in Singapore. Central to this is NTU's Silent Mentor program, which treats individuals who donate their bodies for medical education as mentors, students' first teachers. This part of the exhibition also includes an enclosed gallery that presents scientific specimens of the human body on loan from NTU and the Institute for Plastination. They offer insight into the way medicine is taught while acknowledging the people these bodies once were. Bringing together an exhibition of this scale and complexity is a formidable undertaking, and I'd like to acknowledge some of the people who made Flesh and Bones possible. First, my thanks to Dr. Monique Kornell, who curated the original presentation of Flesh and Bones at the Getty and has been with us throughout the installation of this new version, and you'll be hearing from her soon. We'd also like to acknowledge the Getty for their loan of 35 works from the collection. And we're deeply grateful to our local partners, Singapore College of Traditional Chinese Medicine and the Yanyun Chen School of Medicine at NTU for their collaboration on the exhibition, but for also giving talks at the symposium today. My thanks to all of the artists in the exhibition, and especially those who are speaking later this afternoon. My thanks to the exhibitions team at ArtScience Museum who put the show together, especially Pei Chuan Tan, Adrian George, Jerome Chih, and Joel Chin. And a big thanks to Zin and her programs team for the thoughtful curation of today's symposium. Anatomy has long been a language shared by art and science. Across millennia, artists, anatomists, and physicians have advanced the field through observation, dissection, technologies of seeing, and artistic inquiry. Flesh and Bones sits at the intersection of these practices, making it a perfect expression of what ArtScience Museum exists to do. It's our first exhibition on anatomy, and we've chosen to approach it from a cross-cultural perspective, allowing views from the West to sit alongside philosophies from the East. The exhibition moves across history, bringing rare masterpieces from the past into conversation with powerful artworks from today. We've taken care to balance history with the contemporary, radicality with tradition, medical science with spiritual belief. The result is an exhibition that feels deeply personal, yet universal at the same time. We all exist within our own anatomies, and Flesh and Bones vividly illustrates how we've come to know about the body through scientific study, medical intervention, artistic vision, and lived experience. We think Flesh and Bones will elicit moments of wonder while opening space for deeper reflection. It will encourage sustained engagement in learning, even as it immerses visitors in sensorial delight. As we mark our 15th birthday, we share this exhibition with our visitors as a gift, one that reflects what ArtScience Museum does best, bringing art and science together to deepen how we see ourselves. Thank you.
Thank you, Anna, for setting the foundations for today's symposium. We are delighted to be beginning our program with a keynote lecture by Dr. Monique, which establishes the conceptual ground for the program. Monique is an art historian whose work explores the relationship between art, anatomy, and the history of medicine, and her scholarship, including her work on Anatomies and res Vesalius, has been instrumental in showing how anatomical knowledge is never neutral, but constructed through specific ways of recording and circulating the body. Monique is currently visiting associate professor in the program in the history of medicine at Cedars-Sinai Medical Center in Los Angeles, and she's the curator of the original Flesh and Bones exhibition first presented at the Getty and now reimagined here in Singapore at ArtScience Museum. And in her keynote, she'll be introducing the curatorial foundations of the exhibition and also inviting us to understand anatomy as something that's historically contingent. And it's my pleasure welcoming Monique for her keynote lecture.
Thank you, Zhen, for that kind introduction. It's a pleasure to be here in Singapore to re-engage with the historical objects on loan from the Getty Research Institute in Los Angeles and see them in a new context, enriched by cross connections with the contemporary works on display. So today I'm going to speak to you about the curatorial approach taken for the original exhibition of the same name, held in 2022 in the galleries of the Getty Research Institute at the Getty Center. The focus then was on books and prints of anatomy, mainly in the Western tradition, from the holdings of the Getty Library. The exhibition focused on aspects of how the structure of the human body has been depicted over the last 500 years, looking at early anatomical atlases and in books and prints catering to the education of the artist, all expressions of the fundamental concern in medicine and art for the structure of the human body. Fulfilling a mandate for an image that would indicate what the exhibition was about, for on-site posters, we used this remarkable head from an early 19th century book of anatomy, tilted back to show the red muscles of the neck that contrast with the bright white of the skull lit from above. It is a 19th century illustration from the Getty's significant collection of anatomy books for artists. This is the thematic plan adopted to show the strengths of the collection, one that also supported a broad chronological progression from the 16th century to the 21st. 90 objects were arranged across 2 gallery spaces, which opened on the left with the theme of the living dead animated anatomy. It moved on to artisan anatomy, the antique, life size, surface anatomy, and on the right in gallery 2, anatomy in 3D and the second part of life size. Sharpening the focus, the exhibition was a Los Angeles-based exhibition in that external loans chosen to provide context for the Getty material were bought locally, taking advantage of the rich complementary collections like that of UCLA existing in the Los Angeles area. With fewer plane trips, it was also something that made sense economically and in terms of the environment. And, as it turned out, it had a silver lining of making rescheduling easier when the pandemic delayed the exhibition. At the entrance to the exhibition, we placed a mural of the Leiden University Anatomy Theatre. Being a greatly enlarged detail of a fold-out print found in an early 18th century guidebook, the original small enough to fit in a pocket. The Anatomy Theatre, originally built in the late 16th century, signals the new importance of dissection in early medical schools, part of a revitalization of the study of anatomy across Europe that was based on a critical assessment of ancient texts and an increase in the direct observation of the dissected human body. At the same time, we begin to see naturalistic depictions of anatomy coinciding with the rise of printed books. At the center of this anatomy theater is a dissection table, and beyond, a set of surgical implements in a case. On the tiers, human and animal skeletons are arranged in lifelike poses. The cattle thief, astride an ox, being indicated by two visitors at the right, is a reminder that, in this period, the official source of cadavers were the bodies of executed criminals. An abiding motif of early anatomical illustration was the depiction of the dead as living, often in a landscape and part of the present world. Skeletons and anatomized cadavers strike elegant poses and sometimes participate in the display of their own dissected parts, as in these figures holding up resected flaps to reveal their abdominal muscles. These are woodcuts from the earliest anatomy book in the exhibition, Jacopo Berengario da Carti's short textbook of 1523, produced for the author's students in Bologna. The figures exhibit an uncanny liveliness in view of their anatomized state, and their real calmness negates any potential concern on the viewer's part for the suffering of the sentient or for the taboo of human vivisection. Included in this first section were examples of animated cadavers and lively skeletons of the parallel late medieval tradition of the dance of death, where death snatches the living from daily life, as in this 17th century print after the 16th century series by the German artist Hans Holbein the Younger. A sprightly cadaverous figure brings in a urine sample to a physician while leading an elderly patient by the hand. The inscription, "Physician, heal thyself," from the Bible, here takes on a literal meaning, as the scene portends the death of both doctor and patient. Unlike this figure of death, Berengario's young men, who date from the same decade as Holbein's original, have no decay or ghoulishness about them. The emotive pose of this praying or lamenting skeleton brings with it a suggestion of consciousness, another sign of life. The skeleton is found in an 17th century anatomy book for Bolognese Art Academy, but it is based on one from Vesalius's much-copied De Fabrica of the previous century and has a functional purpose, demonstrating Vesalius's observation that the spine is made up of several bones rather than just one, in order to allow for movement, such as bending over. Until the rise of abstraction and the waning of art academies in the 20th century, anatomy was one of the key subjects taught to artists for hundreds of years, and a reason why anatomy is well represented in the Getty Library. Together with life drawing and copying after the antique, a solid grasp of anatomy was considered the best way for an artist to perfect the representation of the human figure. This scene of a Roman art academy of around 1600 is from the Getty exhibition section devoted to artists and anatomy. It demonstrates the different subjects young artists were taught to prepare them for their careers. This included the study of anatomy, as we see in the detail on the right. In the foreground, two youths draw from an articulated skeleton, and in the background, a cadaver is being dissected under the rapt gazes of young boys, one of whom is eagerly pointing to the open chest. Responding to artists' interest, anatomy was included in early printed drawing manuals, as this one on the right by Jean Cousin, first published in Paris in 1593. The woodcut shows the muscles of the leg. The accompanying text is concerned with their proportions relative to other body parts. In this period, before universal standards of measurement, this leg is 4 heads long, and 3 nose lengths make up the width of the upper thigh. It is in the 17th century that specialized books on anatomy for artists first appeared, and they're still being produced today. These books ignored the viscera, veins, and nerves, and usually included the assurance that the focus would only be on elements of most use to artists, the muscle and bones, structures visible on the surface of the body. The transparent figure on the left is by the sculptor Edmé Bouchardon, from a book first published in 1743 in Paris. Here we see muscles in outline that overlie the bones, effectively conveying their relative positions. And a crochet model, one showing the muscles below the skin, in the same pose, could be bought along with the book, and drawing from such a model from multiple angles was one of the recommendations. The next section explored the theme of anatomy and antique sculpture, long held to be the perfect expression of the human form, the result of ancient sculptors selecting judiciously from nature. A notable theme in anatomical illustration was the anatomizing of ancient sculpture, the conceit of being able to peel back stone to an inner anatomical structure through a fictive dissection on paper. An early and influential example of this is found in Andreas Vesalius's De Humani Corporis Fabrica of 1543, in which abdominal anatomy is displayed encased in a series of torsi, the limbs of which are broken off in a manner that evokes ancient sculpture. Doing so signaled to the reader Vesalius's knowledge and appreciation of the culture of the ancient world, while also serving to neutralize the repugnant connotations of intestines tumbling out of an open abdomen. In the exhibition, we took the wonderful opportunity to display this opening of the book next to an antique torso from the Getty Villa Museum, the first time to my knowledge that this has been done. 2 things are readily apparent from this grouping. The Fabrica woodcut wonderfully evokes the antique contrapposto pose with its angled shoulders and hips, and that the breaks at the limbs and neck are too smooth and the surface too undamaged to be a completely faithful rendering of a specific marble. One could say that the torso has been reconstructed in order to be deconstructed. In terms of Vesalius's place in history, his corrections of the writings of the ancient physician Galen, a foundational source for Renaissance anatomists who had based his observations on animal dissections, solidified the path of the new anatomy, one that relied on the proof of the body. For the number, quality, and the size of its illustrations, Vesalius's landmark work revolutionized anatomical illustration, and it became the model for luxury anatomy atlases to follow. Sometimes the role of anatomist and artist was combined, closing the gap between understanding and depiction. Jean-Galbert Salvage, a French surgeon, provided his own drawings for the illustrations of this large early 19th century book of anatomy for artists, which you will find in the last gallery of the Singapore exhibition that addresses the ideal body. In this exquisite forensic deconstruction of the head at the Apollo Belvedere, red ink is used for the muscles and the dotted outline of the body. Salvage believed that the beauty of the statue's head derived from its bones, which you see adorned with a segment of the statue's distinctive hairstyle with top knot. The Getty exhibition also looked at how the internal structure of the human body is revealed through the skin. To include Michelangelo, renowned in his day for his understanding of anatomy, we bore this print of the Good Thief, one of the saints included in the fresco of the Last Judgment. Whereas Leonardo da Vinci's notes and drawings on anatomy stayed with his heirs and were largely unknown, Michelangelo's works, featuring highly muscled nudes, served as a model for generations of artists. According to an early biographer, Michelangelo planned a book of anatomy that would have dealt with the appearance of the body in motion. Why this subject is so important is demonstrated by these photographs of the changing appearance of the back as the arm is raised and lowered, from Paul Richet's book on physiology for artists of 1895. It also brings to mind in the present exhibition Yuki Hirakawa's double-sided video, The Changing Appearance of the Torso of a Rock Climber. A highlight of the Getty exhibition were these three figures of the 1780s by the printmaker Antonio Catani of Bologna in the section on anatomy in life size. Each are composed of 5 printed sheets joined together, and they are among the first works you will encounter after proceeding through Chiharu Shiota's compelling installation. The Getty exhibition was an opportunity to exhibit this rare set to the general public for the first time since their acquisition in 2014, and to explore the trend, particularly strong in the 18th century, of capturing the body on a one-to-one scale, whether in wax, models, plaster casts, or in print. This could result in very large books, as you see in the case on the left. The Catani books were sold individually, and when joined were probably hung exposed on a wall, and this likely is the reason why so few survive. 2 of the figures displaying the superficial muscles were court sculptures in wood that flanked the lecturer's chair in the Bologna Anatomy Theatre. These were carved by Ercole Lenli and an assistant in 1734, modeled on figures, as was Lenli's practice, of wax and other materials built up on an actual human skeleton. The Catani figures, thus, are a fascinating example of multiple translations from bone to wax to wood to ink and paper. Catani's shop was next to the Anatomy Theatre, so passing medical students could have easily dropped in and purchased them. However, in the course of research for the exhibition, I found an early notice for the series that marketed them to artists as an aid in understanding anatomy. On a nearby wall was this mezzotint of the mid-18th century by the French artist and anatomist Jacques-Fabien Gaultier, of a life-size woman dissected to show the muscles and the vascular system. It also was composed of multiple sheets of paper joined together, which were originally published in a book. The figure provided the exhibition with a splash of color, as well as one of the few overt representations of the female body, which was often used to depict the reproductive system. As in this 16th century engraving from the antique section of a dissected pregnant woman who takes on an antique pose of modesty, concealing a breast and her pudenda, a gesture at odds with her revealed pregnant abdomen. Both show the anatomized female body as an uncannily desirable one, impossibly alive and attractive, beautifully coiffed, and in the case of Gautier d'Agody, gracing the viewer with a coquettish glance. These installation plan views show the visitor's path from Gallery 1 to Gallery 2. We used an anatomized antique sculpture by Salvage on a directional mural to guide visitors up the ramp and past the Leiden Anatomy Theatre at the entrance, and a hanging divider cloth with 4 figures from Vesalius's Fabrica. As part of the exhibition design, several columns were wrapped with greatly magnified details from books in the exhibition, which at this scale achieved an abstract patterned effect. With the representation of anatomy, a fundamental question is how to effectively convey the three-dimensional structure of the human body in its numerous layers and systems. How this was approached in the pre-digital age was the main focus of the second gallery. As an entrance wall wrap, we used a color lithograph from Joseph Maclise's Surgical Anatomy of 1851, showing the subclavian veins and arteries of the brachial plexus of nerves. The illustrations in the book were based on Maclise's drawings after his own dissections, and they give an incredible spatial sense of the body. If you think of the visualization of anatomy today, you think of amazing renderings of 3D MRIs and the interactive software that allows students to digitally dissect the body at will. When planning this section, the initial impulse was to install iPads with an anatomy app, or even borrow a 3D anatomy table as used in medical schools. However, we leaned in on the mandate to explore the Getty's holdings and to share instead the many fascinating ways previous centuries conveyed the body in 3 dimensions. Children's flat books of today had earlier counterparts in Renaissance science, with flaps used to demonstrate geometry and anatomy. With so-called flap anatomies, readers could virtually dissect bodies by lifting successive layers of paper. Johann Remelin's Microcosmic Mirror, as the title translates, was first published in early 17th century Germany and became an anatomy bestseller, with many editions and translations, despite the complexity of its manufacture with some 100 flaps. What makes Remelin's books so unusual are the biblical and alchemical inscriptions and moralizing references on the prints. That Remelin's book is concerned with both body and soul is perhaps the reason why it was so popular. For example, the inscription at the top on the right is from the Old Testament and concerns the transience of life. Returning to Maclise, an Irish-born surgeon who practiced in London, his surgical anatomy offers keyhole views into the body's interior. It was first published in 1851, not long after the introduction in the 1840s of general anesthetics like ether and chloroform, which transformed surgery for both surgeon and patient. It also followed the UK Anatomy Act of 1832, which, in the wake of body theft scandals, expanded the supply of cadavers to medical schools beyond executed criminals to include unclaimed bodies, and Maclise's subject may have been one of these. Maclise believed that before picking up a scalpel, a surgeon should have a secure visual sense of the interior of the body. In this plate, from the expanded American edition of 1851, the chest incision is angled, so the eye travels through layers of skin, fat, fascia, muscle, and ribs. Maclise purposely retained the surrounding body to better orient the surgeon. In contrast, Henry Gray's anatomy, which first appeared in 1858 and rapidly eclipsed Maclise's in population, has illustrations by the surgeon Henry Van Dyke Carter, which generally show isolated structures rather than whole body views, a method also suited to the more compact size of Gray's book. In the exhibition, there was a viewing station for stereoscopic photographs of anatomical preparations, part of a multi-volume series first published in Edinburgh in 1905. They provide startling images of depth and plasticity. When seen through the original handheld viewer, we lent the exhibition here, and the modern viewing station we had at the Getty. To conclude, I want to say a few words about visitor engagement. The exhibition coincided with restrictions on the number of visitors to the Getty Center due to the pandemic. Yet the exhibition enjoyed record attendance. And I think this is because we all share a curiosity about our bodies. There was great interest from doctors and medical students and from artists, for whom special tours were arranged. Visitors in general were keenly absorbed by these early representations of anatomy despite their historical distance. We bought a copy of William Hunter's Gravid Uterus of 1774 from UCLA, and visitors were constantly riveted by this engraving of a fetus in utero, a powerful image for its insistence on realism, for the focus promoted by the truncation of the body, and simply the shock and awe of a life-size subject. Older visitors regularly showed great delight in the Visible Women assembly kit of 1960, which you can also see in the current exhibition, as they remembered it from their childhoods and how fascinated they were by it. It resonates with me for its many historical predecessors. Its direct inspiration was a life-size transparent woman of the 1930s that was based on a male example in a Dresden medical museum. But it also has predecessors in those female models of removable parts in ivory of the 16th century and in life-size ones of wax of the 18th century. The last work in the exhibition was the suspended neon and glass figure of 2018 by Tavares Strawn, a former artist in residence at the Getty Research Institute, which elicited gasps from the viewers for its haunting beauty, who were then struck by the evocative history behind it. This video shows how its pulsating lights indicated the circulatory system. It was stationary, but I was moving when I took it. It is an anatomical portrait of the Black American astronaut Robert Henry Lawrence, Jr., who died in a training event on Earth in 1967, and who, in Strawn's work, is floating as if weightless in space. Because a darkened area was needed for its installation, it was placed in an L in the second gallery, which was not visible until you progressed through the gallery, heightening the surprise factor. Should you wish more information about the Getty exhibition, please visit getty.edu/anatomy, where you will find a list of works and related links, including one to the exhibition catalog. Thank you for listening, and I hope you all enjoy the spectacular expanded version of the exhibition at the ArtScience Museum.
Thank you, Monique, for offering a nuanced lens through which we could enter both the exhibition and today's symposium. Her lecture points to anatomy as a way of seeing that's been shaped through specific frameworks, specific historical conditions, institutional frameworks, and visual systems. And it opens up an important question which we will carry into the series of presentations. How are these ways of knowing the body inherited, and how do they continue to be practiced and reinterpreted today? And our first session, Inherited Bodies, brings this question into the context of Singapore. We will hear from three speakers whose practices sit across biomedical education, traditional Chinese medicine, as well as medical illustration. We are privileged to have with us Professor Pang Weng-san, clinical teacher at the Lee Kong Chian School of Medicine at NTU, and his talk reflects on anatomy education, tracing its institutional inheritance, and how technological developments have transformed teaching, while also surfacing the ethical frameworks that shape how bodies enter medical learning. We also have Eleanor Chua, who is the head of the Center of Continuing Education at the Singapore College of Traditional Chinese Medicine. And Eleanor offers a perspective that's grounded in TCM, where the body is understood through systems of flow and balance. And her talk invites us to consider alternative ways of mapping the body when knowledge emerges through practice and attunement. And finally, we have Chen Mingyue, digital education technologist, also at the Lee Kong Chian School of Medicine. And she speaks about medical illustration dissection as a mediating practice to examine how images shape what is seen or what's hidden. And through her work adapting historical illustrations for contemporary teaching, Mingyue will reflect on how visual translation becomes a form of pedagogy that carries knowledge forward while also reinterpreting it. And their presentations offer three very distinct but interconnected ways to think about how anatomical knowledge is inherited through how bodies are given, studied, interpreted, and ultimately valued. So please join me in welcoming Prof. Pang for his talk.
Right, thank you for inviting me. I'm not an anatomist. I don't do dissections myself and all. I'm actually a clinician practicing in geriatrics. I look after the elderly. But I teach at the Lee Kong Chian School of Medicine, and I teach professionalism and medical ethics. So my focus will be a little bit more geared towards some of the challenges in teaching anatomy and all. Let me see. Yeah, so before we learn to treat patients and all that, we do need to learn about diseases and all. We need to know about the cause and the effects on the human body. So our starting point really, we need to know the fundamental starting building blocks, all right, before we can actually teach our students all that. And anatomy, physiology, biochemistry are usually recognized as the basic blocks as we start learning about medicine. And it's important for us to know what is abnormal, right? But we need to know what is normal first before we know what is abnormal. So going back into history across the world, there are various cultures evolved their own thinking about diseases and cures and so on. And many considered illnesses from a very spiritual perspective, balancing good and evil, right from wrong and so on, right? And I do apologize because my slides are a little bit small. Takes me a bit of problem trying to focus on my slides. Yeah, but early dissection of humans were really considered unacceptable. It was not respectful to dissect bodies and all that in those early days. And Galen, at that time, a Greek philosopher, started dissecting animals and all that. And from his dissection of animals, he made inferences on what the human body might be, which may not be so correct, right? And for many years, human dissection was not well accepted, and all these animal dissections, inferences were really not that appropriate, and so on. Human dissection started around the 14th, 15th century in European countries, and the first dissection of a human body was actually conducted in Italy somewhere around 1315 or so. And then this famous chap, Andreas Vesalius, he published a book on human dissection back in 1543. That was probably the first book ever published about how to dissect human bodies and what it looks like inside, and so on and so forth. Then comes the question, where do you find bodies to dissect? Pope Sextus IV in the 15th century gave official Catholic sanction that students in Bologna and Padua medical schools could dissect human bodies and all. And that was important because it gave some authority, some approval for students to do dissections. And by the 1500s, 16th century, the Company of Barber Surgeons, subsequently renamed the Royal College of Surgeons, was granted a license to receive bodies of executed criminals. So in other words, only executed criminals, as a further punishment, their bodies could be sent for dissection, right? And the surgeon would have an anatomy theater, I think there's a picture shown just now, of how to look at the different organs and so on, and the students will be watching and so on. And then with more medical schools established, there was a greater demand for dissection, and William and John Hunter introduced new methods of anatomy teaching by allowing students to perform dissection. So this was a breakthrough. In the past, only the great professor do dissection, everybody watches. And these two colleagues introduced a method of letting students do the dissection themselves. And if you're interested, this is the Huntering Museum in the Royal College of Surgeons in UK. I have a lot of interest in visiting medical museums. Every time I travel to some country somewhere, I'll try and see where their medical museum is and try and see what they have there. And it's quite interesting. So this is Hunterian Museum, named after John Hunter, of course. But over time, with the increased demand for bodies, the question was, where do you find bodies for dissection? A lot of universities, doctors wanted their bodies for dissection, but where do you get them? So apparently in the 17th, 18th century, they came up with what they call a bloody code, all right? Capital punishment for up to 200 types of offenses. Some of them are not very serious offenses, but they will be executed and the body sent for dissection. It was almost to the shame of the people committing crime and so on. And that was the era of what we call the resurrectionists or body snatchers. In the middle of the night, once somebody has died, they go to the graves, dig up the bodies, steal the bodies, right? And then sell it to the doctors for dissection. So much so that people started building coffins that are very heavy, lead-laden coffins, so you can't steal them and so on. And some people built high walls around graveyards. And some even said, let the body decay first before you bury them. Because nobody can dissect a decayed body. It smells awful, it's all breaking up and so on. So these are all the issues at that time. And there's a famous story of Burke and Hare in the 19th century Edinburgh. These two smart fellows, they invited people passing through the town to stay in their lodge, like a little motel, and give them alcohol, give them wine, make them drunk. In the middle of the night, they'll come and put a pillow, cover their mouths, nose, smother them, and then use their bodies and sell it to doctors for dissection, right? And it so happened that there was an occasion whereby somebody noticed it, found it, and reported it. So Burke and Hare were arrested. Hare was granted immunity because he put all the blame on Burke instead. Burke was sentenced to death. His body was hung, and ironically, his body was sent for dissection. And I understand that the skeleton today is displayed in the Edinburgh Medical School Anatomy Museum. I've seen it there actually, all right? So that's the early story of that. And if you want more information about history of medicine, I recommend a few books. The one in the middle by Roy Porter is a very thick book, about 1.5 inch. I love this book, very detailed information, not just dissection, but a lot of aspects of history of medicine. The book on the right, Blood and Guts, is a condensed version of the middle book. Much easier reading. It's about 1 cm thick, that's all. Whereas the other one is about 2.5, 3 cm thick. The book on the left is a very colorful book. Let me see, Illustrated History of Medical Pioneers. It doesn't just focus on dissection alone. It talks about the early surgeons, early physicians, pioneer doctors, and so on. Very nice historical books. I love collecting these books. I have a whole range of them in my office. And I don't lend them because people borrow and never return me. All right? So I always hide it in there. The other place you might like to look at is some other places. The book on the right here is a book about medical museums in the world, focusing mainly on UK, Europe, US as well. It tells you where all the interesting medical museums are, their addresses and so on. So you can actually, I'm sure you can download it and buy it somewhere. And all of them have got very interesting museums collecting different aspects and so on. The two brochures on the left refers to the Royal College of Physicians in the UK, London. And many of the colleges, both in UK and in Europe, have got a bit of a museum themselves as well. So whenever I travel to these countries, I find some excuse to go and visit their colleges and look at their anatomy collections, their pathology collections, and so on. They're all quite interesting, right? Body donation. Now, things have changed quite a bit. And there are different countries, all with different ways of encouraging people to donate bodies. For example, UK has a HTA, Human Tissue Authority, where you can actually have a bequest when you pass away, donate your body for dissection and so on. USA had something similar as well. I managed to look at this Mayo Clinic, whereby they actually have a very interesting process by, after you donated your body, every year there will be a very formal ceremony, right, where the students are all invited and they will honor the family members of the people who have donated their bodies for dissection and so on. Taiwan has another interesting program called, under the Tzu-Chi University, they have a silent mentor program, where after people have donated their bodies for dissection and all, every year there'll be, if anybody from Taiwan here, you probably know more than I do, right? But they plan to have an event whereby they invite the students, invite the family members of those who have donated their bodies. It's a very formal ceremony whereby the students will show their respect for to the families of those who have donated their bodies for dissection. Now, what about in Singapore? What do we have here? We have a Medical Therapy Education and Research Act, but in short, we call it MITRA. Singaporeans, we like a lot of short forms. So NTR becomes MITRA, and things like that. Anybody 18 years or above can pledge to be an organ, tissue donor, or whole body donor. Whole body is, of course, when you pass away, all right? For the purpose of either transplant, therapy, education, or research upon that. It's an opt-in program. It's not compulsory. So any one of you here, Singaporean, you want to donate your body when you die, you can register with the ministry. And when you pass away, all right, they will come, make sure everything is sorted out nicely, all right? And then your body was taken away for dissection or for whatever science work and so on. After it's all done, they will return the ashes to you when it's cremated, and you can do your burial and so on. Okay, so that's available. This differs from the Human Organ Transplant Act or HOTA. This is a different program. It's not the same as the MITRA. This is where you happen to have a road traffic accident. You are a motorcyclist, right? And you're certified to be brain dead, meaning your heart is still pumping, but your brain has gone. Okay, the doctors can retrieve your organs for donation. So your kidneys, not the brain, kidneys, the heart, and certain organs which are still viable can be used to help somebody else. Then at the end of it, the body will return to you and so on. So this is for the purpose of organ donation, not for the purpose of dissection. It's different, right? So dissection comes under MITRA, organ donation for transplant comes under HOTA. They are different. One is an opt-in dissection, you choose to opt in. The other one is automatic unless you opt out. Okay? So you have never thought about it. You are a young person in Singapore, Singaporean, you get knocked down by accident, right? And you're brain dead. By law, we can remove your organs. Okay? You don't need permission from you anymore. But if you have opted out, then we don't. Okay? So that's the option for that. So now there are newer ways of studying anatomy instead of dissecting and all. I grew up from the era of human dissection whereby 6 or 7 of us, we have one body to dissect. The year 1 dissect neck and below, year 2 dissect head and above, right? After 2 years, the body gets cremated somewhere, another body comes in. We have lots of bodies. Today, we can't find all these bodies anymore because nobody donates and so on. So we have to look at other ways of teaching dissection and so on. So again, in the West, people look at digital ways and so on. And interestingly, now we have more things like CT scans, all right, imaging. You can now look at anatomy by looking at imaging instead. And imaging has now progressed to a very sophisticated area. It can even put colors and all that. So it's much easier to do, right? And it's not so messy as actually doing dissection. But there's nothing like the real thing, putting your hands to it and so on. In fact, I think the US came up with this visible male human and a visible female human. 2 persons donated. One was a Texas murderer executed by lethal injection. The female was a housewife who died of a heart attack. Their bodies were donated. They've been scanned head to toe, and these images are now being used for us to learn anatomy. And some countries have started using holograms. I've not seen this myself, but apparently some countries actually, you wear these goggles and you can look at the holograms of bodies and so on and so forth. All right, Switzerland has also done that. And there's various anatomy software as well where you can visualize organs in different dimensions and so on, right? Now, more recently, of course, now we have this Anatomies table. I don't know whether we have one brought in here for the exhibition, I'm not sure. I know we have one in LKC medicine itself where basically it's a scan of the human body. So now my students can sit at the Anatomies table, flip pictures around, don't need to mess up their hands and so on, and see the body in different angles, different dimensions and so on. But if you ask me, I still think the real body is better. Okay? And of course, Gunther von Hagens in 1977 came up with this idea of plastinated bodies. These are not plastic bodies. What they do is they take a real human body, someone who's passed away, they inject formalin to preserve the body so it doesn't decompose, right? Then there's a process using solvents to remove the fats, some of the body fluids and all. And then they impregnate it with a certain polymer or resin, right? And that body can be preserved, hardened, and you can use it to demonstrate dissection and so on and so forth. Okay? All right? And in LKC medicine, we do have a couple of these plastinated bodies as well, more for teaching our students and all. At the end of it, we ask ourselves that all these bodies, whether they're plastinated or not, are actually real bodies. So who are these bodies? Were they voluntary? Or were they bodies that no one claimed their bodies, so we took them, right? Where did this come from? Okay? Why did they donate their bodies? Or is it because nobody claimed their bodies, right? Where are their families? Would they have a grave at the end of it? Will there be a burial place? Is there an urn for their ashes? Who will place flowers for them? And do they hang in shame in museums and so on? So sometimes when we handle bodies and not able to teach our students, remember that these were people once upon a time. They were real human beings who walk like you and I, people with careers, people with families, and we need to treat these bodies with respect. Right? So we have come a long way in terms of studying anatomy. Now technological enhancements has made our learning much easier, more interesting, but underlying all the new technologies remain the same truth. Real person donated their bodies so that we can have all these new technological things today, right? So that we can learn and we can benefit someone else. And this is something we always try to remind our students. The bodies you touch might be a preserved body, but this is not a toy, this is not a statue, this is a real person who walked once upon a time, right? So in closing, this is my last slide. This is an excellent book on the art of medicine. And interesting, when I first saw this book, I thought it was about the practice of medicine, the art of practicing medicine. It wasn't. When I opened it, it was artworks that show you the history of medicine and how it has evolved over many, many years. All right, it's an excellent book. I lugged it back from a US bookshop, and lots of beautiful pictures about how over the years medicine has evolved, and they use drawings, paintings, and all that to show you things that have changed to the modern day of very advanced technology and so on, right? And that's all I have. At the end of it, I think the motto in LKC medicine has always been, how do we redefine medicine? How do we transform healthcare? And we really need to look at newer technologies, better ways to teach our medical students and junior doctors, and yet remembering and respecting people who have contributed their bodies, their organs to help us understand medicine, right? So that's all I have today. Right, thank you very much.
Very good afternoon to everyone. So it's my turn. And I'm not here to talk about anatomy. I'm sort of here to also talk about why we don't use anatomy so much as compared to in Western medicine. So today I'm pretty nervous, not because I'm standing in front of all of you, but to squeeze 3,000 to 5,000 years of history and knowledge into just 15, 20 minutes. It's quite a big feat, and I hope I can do it justice. Okay, yeah, so if you can see on the image over here, this is where I work. So I'm a traditional Chinese medicine practitioner, so you have to have a license to actually practice in Singapore. Okay, so but I'm from the Singapore College of TCM. So what I do is mostly lecture, I teach, but I also practice on some days. Okay, and today I have with me here in the audience our anatomy teacher as well. She is Western medicine trained, but she has a PhD in TCM. So as part of our TCM education, we also do teach Western medicine related subjects. Okay, and today the part that I'm going to share would be on discovering Qi, vital energy in TCM. Why I picked this part of TCM is because I felt it is something that we have all heard before, this word Qi, right? But it sort of has a kind of a mystery, a shroud of mystery surrounding it. So I also included this image on the top right-hand corner. You probably, if you're a Singaporean or you love martial arts shows, serials, then you might have seen such imagery before. So because of these dramas, serials, people, TCM and the related subjects are sort of shrouded in mystery, and people kind of think TCM is like hocus pocus and they don't really dare to try it. So I hope to kind of dispel some of those myths today through my presentation. Okay, so I was asked to talk about these three topics. Okay, so how the body is learned and understood in TCM, how diagnosis is based on balance, experience, and relationships, and how care and treatment shape understanding of the body over time. So I actually correlated it to two of the major modules that are taught in most, if not all, of our courses in our college. So basic theories of TCM and diagnostics of TCM. So usually these are the first two modules that we teach. Okay. And so of course, there's a lot of information here. I'm not going to go through everything, otherwise we won't finish in 3 hours. Okay, so in basic theories of TCM, because the first one, we see basic concepts of TCM. So it talks about like holism, how we view the body as a whole, not just internally, but also in relation to society, in relation to nature, in relation to the people around us, right? Okay, so the concept of holism. And then you see the next two, yin-yang theory and the 5 elements theory. So something pretty different from Western medicine, right? You don't really talk so much about philosophy in Western medicine, I guess. You may correct me if I'm wrong. Okay, so Chinese medicine is very deeply rooted in Chinese philosophy. Yes. So if you've heard of I Ching, it's a Chinese classical literature where it talks about all the Chinese philosophy, and TCM borrows a lot of these philosophies in how we view the body and how we view the body as in the relation to the things around us. Okay, so talking about philosophy, I believe some of you who have been for TCM treatments before, if you've consulted a TCM physician, you realize that, or even in Chinese culture, you realize that we are a lot more averse towards the surgery, right? A lot of TCM physicians will try and encourage their patients to avoid surgery if possible. Okay, so this is also sort of rooted in our culture, in our philosophy. And TCM is actually a pretty good, a prime example of the black box theory. So I'm not too sure if you've heard of the black box theory before. So basically, if you look at this image here, there's a black box, right? So black box, why is it called black box? It's because you don't know what's going to happen inside the black box. You have no way of measuring it, but you can only measure the input and the output. So what you do to the black box and whatever outcome that happens, you can measure those. But once you open the black box, you are actually doing some sort of input, some sort of interference to it, and it actually changes the actual thing that actually goes on inside the black box. So opening up the black box is sort of like doing surgery to the human body, which is also why one of the reasons why we try and avoid that, or we try and avoid invasive procedures. Okay, so another example would be also not just about surgery, but the way we communicate with our patients, right? So sometimes people might feel in Western medicine, I hope I'm not offending anyone here, but sometimes the Western medicine tends to be a little bit colder. For example, if someone tries and tell you of your diagnosis, it could be a cancer diagnosis or a terminal illness or even an STD or whatever, right? And sometimes you are just seen as sort of a statistic. So they will tell you, oh, you may have only 3 months left to live or 1 month left to live, kind of thing. And just by telling that to the patient, to us, it is also an input. Okay, so by saying that, you are actually interfering with the outcome, right? So the patient, if they had not known that diagnosis, or if they were actually not ready to accept that diagnosis, and we just tell it to them, then it would also change the way they look at themselves and actually how they live their life afterwards, and it would affect their treatment outcomes and also how their body actually takes the disease itself. Okay, so that is a little bit about why we are so, or I would say why in TCM we view ourselves as sort of like a black box example. Okay. Yeah, so this is what I'm just going to share of this part. And then I highlighted Chih over here as well, as you know, this is what I want to focus on for this presentation. So as opposed to blood and body fluids, Chih is like something that you can't see. It's sort of difficult to fathom what exactly it is. So as opposed to blood and body fluids, it actually focuses more on the functions of the body rather than any anatomical changes. So sometimes when in Western medicine, you might have some discomforts in your body, right? You go to a Western doctor and then you do some sort of test. You can't find anything wrong, but somehow you just feel there's something wrong in the body. And this is also one of our advantages in TCM, is that because we have this concept of Qi, this vital energy, and it helps us to give direction to treatments and gives us more forms of treatment to actually treat these kinds of functional issues in the body. Okay? And so I'm going to give you some other examples of how we make use of Qi, okay, the concept of Qi, to kind of make it more concrete for you to understand. Okay, so this page is actually, or what this page describes, how emotion affects the movement of Qi in the body, is actually from the Huangdi Neijing. If it's translated over, it's the Yellow Emperor's Classic of Medicine, or there are a few other different translations, but this is one of them. Okay, so I will give you an example, not go through everything. So for example, emotion, right? We have different types of emotion in our body. When someone feels angry, upset, okay, in Huangdi Neijing, it says that our qi rises. So what does that exactly mean? It's kind of abstract, don't you think? Right. But in TCM, why we say qi rises is because it correlates to some of the symptoms that anger can result in. So some people, when they get angry, or maybe at work, something just makes them upset, or their co-workers are a little bit slower than expected, and then they get upset, right? And then they start getting a headache, or they start feeling nauseous, or they vomit. As a clinician, we see quite a lot of these. So if you've not had experience with these people, it may be a bit hard to relate to. Okay, but some people who get angry, they have neck ache, high blood pressure, right? So a lot of these symptoms are towards the upper part of the body. Okay, so it shows you how qi actually goes upwards. Vomiting, nausea is like, by right, your digestion, or when you digest something, it should go down, right? Your food should go downwards, but then it's going the opposite direction. So this is an example of how qi goes upwards. So we say it rises, okay? And then in TCM, we also have the concept of body constitution. There are many different types of body constitution, very popularized nowadays. Okay, if you've had TCM herbal teas, they might ask you to find out what your body constitution is. So I'm bringing this, one of the body constitutions in, called Qi stagnation, obviously because it's related to Qi, and also because nowadays in high stress environments, this is one of the more common body constitutions that we see nowadays. Okay, so Qi stagnation is like, you can imagine you're in a pressure cooker. Okay, so in a high stress environment, you're like a pressure cooker, and then the air in your body, the energy in your body doesn't flow that well. Okay, so these are some of the symptoms that people tend to have if they have qi stagnation in the body. So the term stagnation, the qi is not actually flowing, right? So it's blocked, right? You can imagine a balloon, okay? And in a pressure cooker, one other characteristic of that is it could create heat in the body, right? Okay, so this heat can cause you to have some headaches. It makes you a bit more frustrated. Okay, sometimes it gives you pimples, or sometimes it gives you ulcers in your mouth. So these are some examples. Okay, yeah. Okay, and usually we relate this to the liver organ, yeah, the liver in TCM. Okay, then we move on to the diagnostics of TCM. Okay, so it's actually split into two main portions. One is if you look at the top part where I'm circling, it's the collection of information from the patient. Okay, and then the second part is on syndrome differentiation. Okay, so because of our idea of black box theory, right, we can't cut up the body. So we are very highly reliant on the external part of the body. And this is also based on the concept that all parts of our body are related. So we have some interesting diagnostic tools where we look at the tongue. I believe if you've been for the exhibition, you would be able to see the tongue models. Okay, those are a little bit exaggerated. Okay. So just by looking at the tongue, it's a little bit like foot reflexology. Each part of the tongue actually correlates to different organs, and they tell you signs that there's something off balance there. So for example, if you haven't had a good sleep and a TCM physician asks you to stick out your tongue, a lot of you would have a red tongue tip, because if you haven't had a good sleep, it causes heat in your heart. Okay, so heart in TCM is related to the mind. It's not exactly just the anatomical heart, but the other parts of the body that are related to the heart as well, which in TCM is like the brain, the mind, our spirit, our emotions, all related to the heart. Okay, so the tip of the tongue over here is correlated to the heart. Sometimes if you don't sleep well, it can cause heat in your body and it becomes red. Okay, then of course, the very mystical part that a lot of people are very interested in is pulse diagnosis. Okay, so how come physicians can just feel your pulse and know so much about you? Okay, so of course that takes a lot of experience, and we are not just relying on the pulse. A lot of good physicians, when you walk into the clinic, they can already see how you walk. They can see the color of your face if you're not wearing makeup. Okay, of course, the hair as well, the texture of the hair, they can tell a lot of information comes from the external appearance of a person. Okay, so we are very reliant on that as compared to Western medicine. So just to share a little bit of my own story, I'm not too sure if you can see, but I'm actually pregnant. So most Western doctors would give iron pills or prenatal supplements, right? But for me, I know my diet is good and I have enough iron in my body. I know I'm not anemic, and I can tell from my own features, my eyelids, my nails, they are not pale. My lips are not pale, right? So I know I'm not anemic. But in Western medicine, because you are always very reliant on blood reports, even sticking a needle in a person is sort of invasive, right? You can't do it at home either. Okay, so sometimes Western clinicians, they tend to rely a bit too much on these blood reports. And then my gynae also said, she kind of wanted me to go on the iron pills. Okay, I told her, no, I don't think I need it. I still went for the blood test and it was all fine. Okay, so just to share a little bit. Okay, and then syndrome differentiation is also something that is quite different from Western medicine, because in Western medicine, you focus a lot on disease differentiation. So everyone can have like a diagnosis of a disease, right? You can have, for example, hypertension, or gastritis, or IBS, scoliosis, for example, okay? But in TCM, we focus a lot on syndrome differentiation. So all these diseases that I mentioned just now, hypertension, IBS, they can all have the same, 2 or 3 different patients can have the same syndrome, depending on the symptoms that they portray. And if their syndrome are the same, we can sometimes also prescribe the same medication, and it actually helps with that condition because it just brings the body back into balance. Okay, so I give you one simple example. Okay, there is a syndrome whereby the liver subjugates the spleen. Okay, so this one is kind of difficult to understand if you've not learned TCM before, but I'll explain a little bit. Okay, so if you look at this image here, it is an image of the 5 elements, the 5 organs. Okay, it's based on the 5 elements. So you can see we usually start from wood. Okay, wood, fire, earth, metal, water. Okay, so in this sequence, they actually generate each other. Okay, but if you keep generating on and on and on, it's going to over-generate, right? There's going to be overabundance, which is not a good thing. Okay, in TCM, in Mandarin, we say 中医. So we want to be in balance, right? Not too much and not too little. So there's also this natural process of restricting one another. Okay, so how do they restrict one another? You see a star in the middle, right? Okay, so the wood actually restricts earth. Earth restricts water, water restricts fire, fire restricts metal, metal restricts wood. Okay, so on and so forth. It just goes in a cycle. So in this example, this is when by right, the liver should restrict the spleen if the spleen is in overabundance. Okay, but if the liver is overwhelmed, so for example, someone is overly stressed, too nervous, like have to come up to do public speaking, right? And then what happens? The liver becomes overwhelmed, though it's in overabundance. Okay, or you make this person angry, so then it becomes in overabundance. So it's going to over-restrict the spleen. Okay, so over-restrict in TCM, the term we use is subjugate in English. Okay, so it's going to over-restrict, subjugate the spleen. If you are a Western medicine specialist or, trained in Western medicine, you would know that the spleen is related to the immune system, right? But in TCM, the spleen is actually related to digestion. Okay, so the liver can actually affect the digestion. So some people, when they're very nervous, they start having diarrhea or they feel butterfly in the stomach, they feel nauseous, pukey kind of thing. Okay, so we use these concepts, these relationships to actually explain these symptoms. And then, of course, when we use herbs to treat, we are going to reduce the liver, we are going to soothe the liver, so-called soothe the liver, medications, herbs that can soothe the liver, and also herbs that can boost the spleen. Okay? Yeah, so same way with the movement of Qi. Just now when I mentioned the Qi is moving upwards, right? So when we use herbs to treat the movement of Qi upwards, we are actually focusing on using herbs that bring the Qi downwards. Okay, so it could be very abstract, but it is sort of like driving a car. You just kind of need to know when to press the accelerator, when to press the brakes. You don't exactly need to know the inner workings of the car to know how to drive the car. Okay, so that's how the association kind of works in TCM. Okay, then we go on to treatment. Okay, so if you see here, obviously just now when I mentioned herbs, right, those are related to treatment already. But I wanted to add in the acupuncture, moxibustion part, because obviously that is when we need anatomy the most, especially when we do acupuncture. If we understand acupuncture, we know where not to poke or how deep not to poke in order to keep the patient safe, right? Sometimes you poke too deeply, it's going to poke into someone's organs, the lungs, and so on. Okay. Okay, so meridians and acupoints. So if you want, you can take an image because there's a lot of information. I'm not going to go through everything. Okay, so meridians are pathways to transport the energy, the qi, and the blood. Okay, and obviously they are going to connect the internal organs with the external parts of the body. Okay, so the meridians, they are sort of how our inner parts of the body connect to the outer parts of the body, like our eyes, our ears, our nose. So you can see you can get information from the external part of the body based on some of these outer appearances. Okay, and then acupoints, they are also places which can reflect places of disorders. Okay, so there are some acupoints on the back, so related to our different organs. So for example, like when I was pregnant, right, I had heart palpitations. So when I press on the acupoint that is associated with my heart, it is actually achy. So I can feel pain in that point, okay, when I was having heart palpitations. Okay, some people, they have diabetes. When you press on the pancreas acupoint, there's also pain in that area. Or sometimes it's a misalignment of the spine, which are correlated to those acupoints. Okay, and obviously that is also where we stimulate. Okay, so these are some of the meridians and acupoints. Okay, you can find these online also. They are very easily assessed. Okay, and usually when we talk about meridians and acupoints, we also kind of correlate it to our railway network, MRT in Singapore. If you are Singaporean, then you can correlate it to your MRT. Okay, if you are from another country, you can correlate it to your own country's metro system or subway system. Okay, so meridians are sort of like the lines, right? The railway tracks. Okay, the lines. And then the acupoints are the stations. Okay, so we use this sort of analogy. So some acupoints are used more than others. Why? Because they are like the interchanges. right? So at these interchanges, what happens? It becomes very crowded. Am I right? Okay, so when it becomes very crowded, you get more blockage, you get more human traffic, and that is where problems occur, right? Okay, so in the body, the meridians and the acupoints where there's more blockage, then that is when we will want to do something about it. Okay, either ease the traffic, reduce the blockage, or get rid of the blockage. Okay. Yeah, so why is blockage bad? In TCM, we believe there are a few mechanisms of pain. So one mechanism is blockage can cause pain. And then the other one would be malnourishment causing pain. Okay, so for example, blockage causing pain is quite easy to understand, right? Like you have a bruise somewhere, it's obviously a blockage, you press on it, it hurts. Malnourishment causing pain, sort of like how you, one part is already blocked and then everything else behind it, the blood is not going to go there anymore, right? So it can cause pain in that area as well. It's also an imbalance. Okay, so these are some examples of the acupoints on the back. Okay, so for example, if something is blocked, it is an access problem. We want to get rid of the blockage, right? So some people would do moxibustion. Sorry, not moxibustion, the cupping. Okay, so cupping, you kind of suck out the blood from that area. Sometimes you do a bit of bloodletting, or sometimes it's just cupping is sort of like a mild form of bloodletting, right? Okay, you have a bit of bleeding under the skin. So that kind of relieves some of the blockage in that area. And then when you want to nourish that portion, then you do a bit of moxibustion. So I'm just giving you a simplistic example, okay? Yeah, so that is a bit the treatment. So this is my last slide. Okay, so just to end off, I believe a lot of us think that TCM is more subjective. We tend to, in terms of diagnosis and treatment, okay, two different physicians can treat in completely different ways. But it doesn't mean that it will lead to, it doesn't mean that the treatment is not going to work, right? If you've heard of the blue zones, you can find it in many different continents. Blue zones are where people live to more than 100 years old, right? They have different cultures, they have different societies, different lifestyles, but it all ends up in people living to over 100 years old too, and they're all very healthy, right? So it's many roads lead to Rome, right? Okay, so, but of course, being subjective is our strong point, and I would like to say that even though we are less objective compared to Western medicine, but we know that they are more objective, and I believe that we can actually work together, integrate. I believe the future of medicine, especially in Singapore, would be to integrate both TCM and Western medicine. And with that, I would like to end my presentation. Thank you.
All right. Thank you, Eleanor, for your sharing about TCM. It was very interesting. So, hello, everyone. My name is Mingyue, and I am a digital education technologist from the Gongxian School of Medicine. So today, I'm here to share with everyone a little bit more about medical illustration, which is the process of creating visual artwork that is then used to aid in the teaching of biological and sometimes chemical subjects. So through my sharing, I will be showing you some footage here, which relates to some of the processes involved in medical illustration. So it both involves from the past until the present day, things that have been done to create these illustrations. So let me just hit play. All right, and we're off. So some of my colleagues and mine and me have been embarking on a project to modify some old anatomical illustrations by Dr. Henry Van Dyke Carter, which I think you've also heard about it before this in another presentation today. He created the illustrations for Gray's Anatomy, which is a popular resource for students when they're learning anatomy. However, despite it being really high quality images that are still relevant today because of its accuracy, the big issue we faced in using this resource is that some of the labels in these images have become outdated. And since these labels were embedded into the image, it is a slightly, I would say, invasive task to remove these labels out of the image. But it was necessary to do them in order not to confuse our students. So Gray's Anatomy, like I mentioned, is quite well known for these images, and it was quite popular. And in this video, I'm using one of the images created by Dr. Carter for Gray's Anatomy. So this image in particular is depicting the blood vessels surrounding the knee joint. Right. So Dr. Carter originally created these images in the late 1850s. So interestingly, he would have been around my current age at that time, so mid-20s. Yep. Back then, like mentioned before, books were predominantly printed using woodblock printing technique. As such, these images were actually created using Victorian wood engraving. So these illustrations were carved onto wood blocks, and then these wood blocks were used to stamp onto the pages to replicate them for multiple books. So on the screen now, you can see me demonstrating the basic concepts of wood engraving. So first, there was the tracing and transference onto the wood block, and now I'm going to be starting the carving with engraving tools. In my case, I used my iPad as a makeshift light table to do the initial transference of the reference image onto tracing paper. And then because tracing paper is semi-transparent, I can flip it over, paste it onto the wood block, and then trace everything again with a pencil, and that transfers the graphite markings onto the wooden block. So for actual creation of Gray's Anatomy in the past, they would have been using much better quality materials and tools because they are specialists in this area than what I use in this time lapse. Not to mention, they'll be doing this with people with more experience and skill in the medium. So Dr. Carter specifically worked with the wood engravers in a company called Butterworth and Heath. And so during the creation of the book, Dr. Carter first started by making illustrations on paper for the engravers to copy. But it was also said that he transitioned into doing the illustrations directly on the wood itself, which is quite impressive to me because that requires the artist to draw in reverse to what he wants to see in the final printed image. All right, so while I wrap up the wood engraving demo, I'll be doing a test stamp as well. And then in the video, you'll be also seeing me moving on to a digital demonstration of some illustrative techniques used to differentiate different body materials that Dr. Carter used. And this distinction is quite important to the readability of Dr. Carter's images since it was all, well, most of them were done purely in monochrome, so only black and white. As such, some of the techniques that Dr. Carter used specifically are illustrative techniques that are compatible with this circumstance. So some of these techniques include stippling, hatching, and also through the spacing of his mark making to create the illusion of shading and three-dimensionality. Yeah, all right. Yeah, there we go. So for this time lapse, I am mimicking the style he used for 3 different materials. So the first one that I'm doing now is the muscle fibers. And then on top of that, I'll be showing you generally how it looks like for the fat. And then at the very top, it will be the bone. And after that, I'll also be showing you the same 3 materials, but using a style that is more similar to what we see today in modern day anatomical illustration. So while I do this, I think for this one in particular, for the bone, I also showed a cut in to show you how the inside of the bone looks quite different as well. So as you can see, even though it's only in black and white, we use different ways of doing the marks in order to show the difference in structure. So also to notice about our new illustrations that are fully colored, I think that one reason why it looks so different is because gradients are really good at creating 3D forms and show the smoothness and roughness of surfaces based on how much you change from one point to another. So the steeper the difference is, the shinier it will look to you. Now that the burden of showing 3D form is being sort of lifted from the line work like in the traditional artwork, we can sort of bring in a little bit more of accuracy in the texture because we can give it a more uniform texture compared to what Dr. Carter did. What I mean is to say, during Dr. Carter's time, because he needs to show certain parts of the image being brighter than other parts, he would omit certain details on the texturing in order to show that, oh, this part is lighter in color than the other part. Yeah, so here now I'm showing a comparison between sort of the more traditional way of rendering compared to in color. I would also like to add that some of Dr. Carter's images were allowed to have one or two more colors. For example, we would sometimes see for specific blood vessels that they will use a layer of red ink for arteries and a layer of blue ink for veins. So this convention is quite established in medical illustration for showing the difference between arteries and veins. Although I think we all know that veins are not blue in real life. Many medical illustrations depict them as blue to differentiate them from the arteries, which would look nearly identical to the veins in real life. This is an instance of medical illustration straying a bit far from reality for the sake of its clarity as a learning resource, rather than a record of observation. So here on the screen, I'm showing you the process of copying from Dr. Carter's image and then creating our own version of fully colored image. So while that's going on, I'm going to share a little bit more about some things that we change from how Dr. Carter created his images. For instance, there are some images in Gray's Anatomy that specifically has very limited color palette. Okay, so instead of saying that, I suppose you can say all of the images in Gray's Anatomy has a limited color palette because of their circumstances of printing at that time. So, however, while we were creating new images, we chose deliberately to color entire images, even for the specific illustrations that used to highlight certain body parts by having only that part being colored. For instance, in this example, the original image only colored the muscle with a red color, but in our version, we tried to color all the different parts. And this reduces the visual emphasis in the original, which we felt that the relation between this body part and the surrounding area was equally as important. And this was also to facilitate other educators to do their own editing and choose to highlight different parts of the same image instead of only using the use case of the original artwork. Something else we deliberately modified that I'm actually not showing, unfortunately, in this particular example, is that we deliberately used a darker skin tone than commonly used in medical illustration. For Carter, he generally left the skin unshaded for any of the illustrations that does not focus on skin. The only exception to the color of skin being that for the set of illustrations he did for surface anatomy, which is quite heavily shaded, so it turned out to look quite dark as well. Since there is no significant anatomical difference between people of different races, we saw this as an opportunity to contribute to diversify medical illustrations. All right, so beyond these changes, you might notice other inconsistencies that are not quite intended from between our new image and the original image, and those arose from what I can only describe as a skill issue, in that Dr. Carter has amazing precision and line control that I do not fully replicate. So there's no world where I would proclaim that our edited images are artistically superior to Dr. Carter's work. And beyond that, as a medical practitioner, Dr. Carter created many of his illustrations from scratch to his memory, which I think sets him apart as one of those true medical illustrators, instead of just an illustrator doing medical drawings. Right. And also, Dr. Carter and Dr. Gray, they both did a lot of research into creating Gray's Anatomy. They did things like conducting dissections. They referenced to other medical illustrations at that time, and they also examined teaching aids at medical institutions. Plus, some of the images in Gray's Anatomy took heavy reference from existing work by others, as evidenced by some other people being credited in the captions of those specific images. So currently, I'm showing the time lapse here, and I would like to also talk a little bit about our process in the modern day in creating these images. So much like how Dr. Carter created his work not in isolation, but in collaboration with other people, we also have, our process also involved collaboration by checking in with our content experts, in my case being the anatomy teaching staff, to make sure that the final illustration we make is accurate. So for the final image showing in the video, this would be something more like the first draft, in which I would bring to our content experts to verify the accuracy of. As someone who did not study anatomy extensively, I did encounter some difficulty in discerning parts of Dr. Carter's illustrations, especially when it's completely monochrome. As such, content experts is also essential to creating medical illustrations for us today. All right, so this is the last footage I have to share. I hope you enjoyed watching that. In conclusion, medical illustration has been evolving with technology. There is a shift from monochrome prints to fully colored digital illustration, and in recent times, there's also a shift towards 3D modeling. Throughout this entire process, there has been a demand for visual material that is not exactly the same as what we see in real life in observation. So what I mean to say is that in medical illustration, there is a degree of exaggeration that is always involved. For example, through the use of vibrant colors, impossibly clean dissections as our point of view, as well as showing things that are hard to see with the naked eye. For example, in this image, it will be things like the grain direction of the muscle fibers, which we don't really see using our eyes when we observe our muscles. There's also omission involved in medical illustration. For example, there's intentional omission for the sake of visual clarity, and there's also circumstantial omission due to things like a limited color palette. And at the end of my presentation, I would like to circle back to Dr. Carter, who was respectful towards others, the contribution of others that enabled his work as a medical illustrator. But he was unfortunately robbed of the same regard multiple times by his collaborator, Dr. Gray. We know that Dr. Gray did not view Dr. Carter's contributions for Gray's Anatomy to be equal to his own, because he requested Dr. Carter's name to be printed in a smaller size after he received the first manuscript of the book, where on the title page, their names were initially presented in the same font. I find some resonance between Dr. Carter's experiences at that time with many artists' lives today in the wake of mass theft by generative AI companies. To some degree, it is natural for credit to become muddy over time because the degree of separation between the audience and the creator grows. For instance, we do not know the names of the employees of Butterworth and Heath that created the initial engravings for Gray's Anatomy. We do not know the names of the clinicians that helped with the dissections conducted by Dr. Gray and Dr. Carter, and we do not know the names of the subjects of those dissections. At the same time, I think we can all understand the want to respect their contributions. Even as their names are lost to history, their legacy remains a tangible part of our lives today. And while its impact may be negligible, I found it fun and meaningful to help to extend the life of Dr. Carter's illustrations for a little while longer, even as we make our own marks for those who come after. I hope I shed some light on medical illustration and how it has been made, though this definitely do not represent the entire scope of what is out there for medical illustration, especially since my current work focuses so heavily on referencing and also sometimes tracing these medical illustrations that have been created 100 years ago. Thank you.
I'm sorry about the little technical glitch. Thank you so much for all of your presentations. And before we open the questions to the audience that we have today, I would love to just stay with a thread that has been present across all of your talks. The question of how Western anatomical frameworks travel and how they are taken up or reconfigured within different kinds of pedagogies or ethical systems, but also embodied practices, especially in the Singapore context. And maybe we can start with Monique first. Monique, your keynote traced how anatomy emerged through quite specific conditions in early modern Europe. And when these frameworks travel across geographies and into contemporary contexts, do you notice what tend to kind of remain most stable and what tends to shift?
With the early anatomical illustration. Yes. With historical surveys, you usually seek out who innovates, what's the next step. But in reality, most of anatomical illustration was copying. There were 200 years of copying and adapting Vesalius, and then followed by another highlight of the 18th century Albinus. And back to your question of how do contemporary artists relate to the history of anatomical illustration, is that so it's funny, every once in a while I can see the same process. If you go outside of the Science Museum in Los Angeles, on a bench is engraved one of Albinus' skeletons. They still pop up. But generally, when I see anatomy and contemporary artists, they're more inventive. And I think you can see that in the exhibition with, is it Angela Su? She takes anatomy as a starting point and applies and makes it almost botanical and inventive. There's not the stricture to be accurate in any way. It's more of you sort of recognize it as vaguely anatomical, but there's a lot of latitude and interest.
And Prof. Pang, perhaps I could just bring you in here. In the Singapore context, how do you see this sort of inherited frameworks being adapted within medical education today? For instance, are there aspects that remain quite embedded, and maybe others that require a little bit of reconfiguring or some rethinking, particularly in relation to perhaps local, ethical, or cultural contexts?
Because once you know where it's originated, where it's inserted, you know that there is muscle contact. What movement do you achieve from it? Let's say whether it's an arm movement or a finger movement or something. And I think it's important for students to put that thing, correlate their anatomy into the function of the person and know that something happens to that part of the. Oh, thank you very much. and you know that any injury to that part of the organ system, what would be affected. So I think it's still very relevant for medical students, junior doctors today to have a good understanding and knowledge of anatomy, structures, and so on. The other thing, of course, is someday, somewhere, some of them would become junior doctors, assisting in operations, for example, or even learning to be a surgeon. They need to know anatomy well before they end up cutting the wrong parts and, damaging somebody's nerve without realizing it, and so on. What's moving on ahead now is that it's not just the anatomy part of it, but imaging is helping us a lot. CT scans, MRI scans. My generation probably doesn't know how to read CT scans and MRI scans because we were never taught that way. But increasingly, the next generation of doctors will need to know how to interpret using scan images and so on. So they don't rely so much on the anatomical dissection as such, but really dissecting using scans and so on, which is becoming more important. Partly because we are finding it more difficult to get cadavers now. All right, not many people donate cadavers. In the old days, there were a lot of unclaimed bodies, and that enabled us to use that for dissection. Today, we don't have that much donated bodies or unclaimed bodies. We are depending on bodies that we purchase, plastinated bodies that we purchase from overseas and put in the anatomy lab for students to look at. And you can't have every student cutting up a plastinated body because once you cut it, it's gone, So they use that as references instead. So I anticipate that in time to come, imaging will play a greater role and we need to teach our next generation how to look at images.
And I'm going to come to you, Eleanor, next. I know in the final slide, you kind of touched on it. And your presentation offers a very different way of understanding the body that doesn't rely on dissection or fixed structures. How do you position TCM in relation to the more dominant anatomical frameworks? Do you imagine that it runs alongside them or intersect with them? Or maybe even challenge them?
I think TCM is a very big field. So it's not easy to just say whether it challenges or whether it runs alongside. So for example, if you are doing tuina or massage, similar to chiropractic kind of maneuvers, right? You would definitely have to know the anatomy pretty well. Right? You need to know which part of the body you're actually going to maneuver. Otherwise, you might actually hurt the spine or certain nerves, right? Whereas if you are going to specialize in like gynecology, then a lot of times we are using herbs. Sometimes we do acupuncture, but then it's in some of the areas where the organs tend to not get pierced that easily. Or, I mean, you don't have to have such a big or strong grasp of anatomy. You sort of need to know where the anatomy and anatomical parts are, but you don't have to do surgery, right? So you don't have to know where exactly all the nerves are, all the blood vessels are. Yeah. So, so it really depends on which part of TCM we specialize or practice in, or focus or have special interests in. Yeah.
Maybe may I add a comment to that? Some years ago in my previous hospital, we actually employed a Chinese physician working with the Western doctors and all. Our challenge was that because of the way it was structured in the hospital, she had to be limited in just doing acupuncture and physiotherapy, but not giving herbs and so on, right? She was quite good because she actually worked closely with us. We'll refer all the musculoskeletal problems to her as well. She will assess and give us her view, what needs to be done. We will approve it, let her do the treatment, whatever. And sometimes things did work out quite well for patients. But after a while, she felt that her skills were limited because she was not allowed to use Chinese medicines and all. So she resigned after some time because she felt she was not used maximized as such. But as far as the acupuncture and all that was concerned, we had no issues. Patients consented and we allowed her to do and so on. But we couldn't really bring that prescribing of herbs and all that into the clinical practice itself. I think hospitals are a big concern about medical legal issues and so on. That's quite some years back.
Prof, can I take the opportunity to ask you, then how does a student today navigate between these very different modes of teaching or different modes of representation?
So the simple answer is that when we're teaching our students Western medicine, we don't teach them Chinese medicine because we ourselves don't know anything, We just let them know that there are these other options, but it's not part of the curriculum. So my med students in their 5 years do not get any actual teaching on TCMs, right? But they are aware that there's TCM and that this is a bit about what they do. That's all.
Okay, so they are sitting in parallel systems for now. Okay, Mingyue, I loved your presentation, and your work sits in a very interesting position where illustration becomes sort of a site for translation. When you adapt historical images, to what extent do you see illustration as maybe reinforcing existing anatomical frameworks, or as having the capacity to maybe reshape how the body is being understood?
Thank you for your question. I think that because it is necessary for medical illustration to still somewhat be realistic in sense of there's a very specific aim for all these images. It is to teach a specific sort of to show relation between, say, different parts of the body, or how a body is supposed to look like in normal circumstance. There's not that much room for changing anything drastically or to add something that didn't exist beforehand. But I'll say that there's definitely a conversation between the original work and whatever we create now, in terms of, say, for instance, the color of the skin, for example, as an example here. Since we do not know the identity of the dissected body, if it was based on a dissected body, we cannot say that it is more unrealistic, say, to change the skin in a different color, say. So I think in that particular instance, it will be up to the discretion of whoever is creating these medical illustrations to decide how you want to contribute to the field of medical illustration. And beyond that also, say, for example, in some of the images that I worked with, there are some that still contains illustration of the clips or tools that they use to peel back the layers of the skin. And so over there, there's also some potential to change how we want to do the windowing in the future anatomical illustrations, even while we're basing it on the original work.
May I ask first? Thank you for your talk, but could you tell us, I'm curious, why you are using Gray's illustrations, Carter Gray's?
Yes. So specifically for us, this project was brought to my attention by one of the anatomy teaching staff in our school. So he really liked the original images created by Dr. Carter. And part of it is also because he found the access to these scanned images through one of the websites called Bartleby. So that was the website we used for the scanned images. And since it was a resource that was free and also high quality, we decided this was a good resource that we can use and edit for our students. And since it is in public domain as well, we don't have to be too concerned about copyright issues if we were to edit and then release in the future, say, for example.
And I'll just say that you can buy, like, I don't know, the 30th or 40th edition of Gray's Anatomy now, but it does not look like yes. So, no, it's a very interesting project. And so do you then manipulate the images if a professor comes to you and says, I want to highlight a certain aspect of something? Do you work with professors that way?
So far, well, this project is still quite in its infancy. So far, mostly what we've done is only to say for certain images where only one section is colored, we chose to expand it to coloring the other body parts. So far, it hasn't been like we want to remove a certain thing. It's more just to add. Yeah.
Thank you, Mingyue and Monique. We would love to get to your questions. If there's been anything percolating or you're curious about, please put up your hand and my colleague Joreen will come to you with a mic. Do we have a question for any of the speakers? Okay, I'm going to come to you in a little bit. Maybe I'll just get one question to the panel then. Maybe first, Prof, because we've been talking a little bit about the Silent Mentors program within the museum team. It's such a sort of a moving shift from anonymous bodies to this sort of programs today, and where the donor is recognized as a person with life and relationships like what you shared. Do you think this ethical shift is this ethical shift changes only the conditions under which anatomy is taught, or does it also transform the meaning of the body within medical education?
I think silent mentors will only be one component in terms of trying to teach our students to respect patients, respect bodies, and respect contributions that other people have helped them in terms of the learning of medicine. So it's just one component. So the ethics and professionalism teaching goes through the entire 5 years. Other than respecting bodies, now we take them through other issues of how do you deal with patients with depression, how do you deal with patient family issues, right? We try to see how we can incorporate some thinking about recognizing people beyond the diseases that they have, their family backgrounds, the controversies, difficulties they have, and so on. So incorporate it throughout their 5 years of training. So recognizing the mentors is just part of the entire whole program. Yeah.
I have a comment. So we were discussing earlier that in early modern history, the sanctioned source of bodies were those of executed criminals. But they were also honored in some respect. After the dissection, their bodies were collected by fraternal brotherhoods. And, before, the same fraternal brotherhood escorted prisoners to their execution sites and showed them images, religious images, reminded them of God, and then took their bodies to dissection, collected them afterwards, and gave them Christian burials. And then that was actually part of the expense for the university dissections.
Thank you. I would love to get a personal question to all of you. Has your way of understanding the body shifted through your own practice in any way? And I'm asking this question because I read something Eleanor wrote about her pregnancy, which dialogues really beautifully with your practice in TCM. So maybe I'll get Eleanor to share a little bit first.
Yeah,
Could you just repeat?
Has your way of understanding the body shifted through your own practice in your respective fields? So for you, TCM, Eleanor.
I think at this point in my life, I'm at crossroads. Also, one reason is because currently the TCM landscape is in a transitional state. So what I mean by that is in Singapore, in the local context, we might integrate with Western medicine. That seems to be the trend. And of course, with that also comes with some of our own concerns because of, once we start moving, like our river, right? Once it moves into the main flow, will it actually affect the way TCM is being taught, or like how people who are trained in TCM would actually think that will it still remain, or will it still retain that traditional sense of the TCM philosophies? Because even in China right now, it's very highly integrated, but even those who say that they are TCM physicians or they use TCM, they use acupuncture, but a lot of times they are very highly reliant on invasive reports or invasive tests, and a lot of times they are actually using the Western way of thinking, but then using TCM treatments, and sometimes the outcome is not exactly that desirable. Yeah, so that is my point of view. Right now, I'm still at crossroads. I can't make up my mind whether I think that is the best way to go, or is whether there should be some restrictions to kind of retain the essence of TCM, because it's very easy to use these like MRI, ultrasounds. It's so transparent, people find it so attractive and easy to use, right? But sometimes the easy way out is not exactly the best way, I would say.
Yeah, just a quick response to that. Yes, some of my patients, I see elderly patients, some of them still prefer TCM than all my Western medicines and so on. So back to my own thoughts about, as I look at my own work now, I'm beginning to, because I work with the elderly, I'm beginning to move more and more away from their physical complaints to their psycho-spiritual issues instead. These are all my patients are in their 70s, 80s and so on. While they come to see me for aches and pains, physical problems and so on, I can see that what bothers them is not just the physical issues, but their own psychosocial issues, whether things like, their spouse has passed away, or they are getting old themselves, they're having issues with the family conflicts and all. Children have migrated to some other country and the old person is left alone. I focus now more on their psychosocial, spiritual issues than on their physical issues. The physical issues seems to me their reason for coming to the clinic and for which my hospital is charging them, But the issues I have to deal with are not so much physical. They come to see me for the chat, for the conversation, to deal with them. And I remember my own parents, when they were elderly, they passed away. They used to go to a clinic in a hospital, and they tell me that after seeing the doctor, they would love to go to the canteen to drink coffee, And it was part of their routine. See doctor, drink coffee, and then come back. And to me, I'm quite happy with that, It wasn't the medicine they were looking for. It was doing things together, going to have a drink. And I thought that psychosocial, that spiritual issue was becoming more important in my older people than their physical issues. And I've learned to shift my focus on my conversations with them, not just to how's your pain today, how's your body today, but, how have you been spending your time and so on. Instead, I'm learning a different thing from them.
For me personally, my journey in medical illustration, I think, brings me some different opportunities than what I expect from my work, which is I have the opportunity, because it's such a big project that has the potential to go on for a long time, with how many images there are available for us to take and give new life to in some ways. I get to work with some of my colleagues and teach them a little bit about how to do digital illustration, which I think was unexpected but very interesting thing that this project brought to me when it comes to the human body. And also, I'd say that through this project, it also gives me a bigger appreciation for another aspect of a subsection of art that I don't often encounter out there, because I am quite a online sort of person, so I see a lot of digital art, and there's this subsection called gore, if you know. So these are people who enjoy drawing characters but in violent situations, and a lot of them will contain things like exposed intestines, or say a cut at the neck, things like that. And then in those cases, you have the opportunity to see how young people are currently interpreting anatomy, and how Some of them, they will talk about learning anatomy through medical illustration in order to create artwork in the gore sort of fashion, but more accurately. So that's one thing about how in youth artists now, this is one of the ways where medical illustration interact with art.
Well, and also, manga and anime. It's not just gore, but for these hyper muscled figures. Or there's one series where they're all without skin, just muscles. Do you know which one it is?
Attack on Titan.
Attack on Titan. So,
Yes, that's true.
I almost forgot the question. So I was just going to say that what's changed for me, I began studying the history of anatomical illustration because I was interested in late 16th century Florentine artists. And they were studying anatomy and they were talking about it and writing about it. So I felt I needed to understand what they were reading. And that was my rabbit hole. But I first learned anatomy from Vesalius, from Valverde, all 16th century sources. And this went on for a long time, and Grays. But now, it's nice to layer that with these great apps that you can manipulate the body. Could be on an iPad. So I have that base. I also studied briefly, very briefly, an anatomy course for artists in a dissection lab at University College London, which was important. It was very important to know, to be with an actual body. I think you were always saying in your talk how these are great advances, but it's no replacement for having an encounter with an actual body, to know it in 3 dimensions. Yeah, it can't just be in 2D.
Well, thank you, Prof. Pang, Mingyue, Monique, and Eleanor, for opening up such a rich set of perspectives, and for all of you for leaning in. After a short break, we will move into our second session for the symposium, which shifts systems of knowledge to artistic practices that reflect on the body beyond anatomical classification. Please join me in thanking our wonderful first panel of speakers for their contributions. Welcome back, everyone. We are moving into the program's second session after anatomy, which engages with artistic practices that explore what happens to the body when it exceeds formal systems of definition. And our first speaker, Wendi Yan, is an artist and a historian of science whose work explores alternative trajectories of scientific thought. And in her work, Dream of Walnut Palaces, she imagines a meeting between Taoist philosophy and Enlightenment science, staging a speculative encounter between different systems of knowing the body. Japanese artist Chiharu Shiota's work emerges from deeply personal experiences of illness and displacement, and she transforms them into installations that give form to what is often quite difficult to articulate. And in her work, The Network Within, which is the first and the final work you will see in Flesh and Bones exhibition, she draws from her encounters with mortality and fragility and asks, what does it mean to exist as a body that is at once individual and interconnected, present and dissolving? Dr. Yanyun Chen's practice engages the body as a site where memory and experience are inscribed. And in The Scars That Write Us, she approaches keloid scars as sculptural forms that carry lived histories and gives material presence to the process of maybe slow and uneven healing, suggesting that the body is continually reshaped by what it has undergone. And Woong Teng's work examines how bodies are imaged and understood within medical contexts. So in Rules for Photographing a Scoliotic Patient, she reflects on the experience alongside those of her collaborators, exploring how diagnostic systems try to standardize bodies that resist alignment while opening space for more intimate, individualized ways of seeing. And across all of their artistic practices, the body is approached as something lived and continually reinterpreted. And it's our pleasure inviting Wendi Yan to kick us off for the second session. Wendi, please.
Hello. Thank you so much for having me here today. It's really exciting to be here for this symposium because normally I have to do a lot of explanation of like relevant terms and lineages of ideas, but today I don't really have to do that anymore because of the previous talks. So yeah, I wanted to basically talk about this film that I spent about a year making, from research process to the actual production of the film. It's a 10-minute CGI animation film where I imagined kind of another history of science based on my research. So my background is in history of science, but I'm an artist and technologist, so I try to kind of do everything that I love doing all at once in this project. And I'm going to dissect a little bit of the filmmaking process by roughly following how the film starts to how the film ends, as I explain kind of what happens in the film, but also showing you the behind the scenes of making the film and the research that led to my decision making. So the film opens with you're on a balloon, you're on a hot air balloon. You basically hear from a monologue from a narrator who's basically a Chinese Taoist person with a lot of knowledge in traditional Chinese medicine, but then also he knows Latin and he knows a lot of the Western knowledge as well. And he is dreaming, and so he kind of recounts his dream and some of the questions that led him to where he ended up in his life. And so then he kind of gradually he sees two giant walnuts in the sky. And basically this entire film happens in the two walnuts. So personally, I grew up in China and I spent most of my adult time, well, all of my adult time in the States. And I really am kind of like a product of both education in both countries. And so naturally, it's very interesting to me when it comes to knowledge transfer and translation of ideas, not just linguistically, but then also cosmologically, philosophically, and also how that transfers to the images that we see, the images that get produced, and also like all the narratives and the metaphors and everything that kind of percolates in culture. So I really basically then when I make art with 3D software, which is like, I make 3D models and then I give them materials and then I give them literally like bones in the 3D software. And then I animate them. I put them into worlds that I build in another 3D software. And then I give them kind of procedural logic so that they move in a certain way. And then I run a virtual camera inside. It's kind of like a whole virtual world where I get to kind of create things as if I am a god in some way. And it's really fun to essentially use this entire kind of sort of technical process I learned, which is what, Hollywood industries, game industry, Hollywood and gaming industries use for making films and games as my own way of building other worlds that I want to see that I don't get to see in normal media. And I've come to realize recently that I've also come to use these tools as essentially my knowledge tools. Instead of Google Docs, I make 3D models, and then I make animations, and then they also become games sometimes. And yeah, so essentially this film is sort of my way of metabolizing certain research that I spent a long time doing. And what I was really thinking a lot about from my history of science research for the longest time was really like, I feel that there's a lot of things that get lost in translation when you translate words from Chinese to English, but then also when you translate ideas from one knowledge system to another. And so the beginning, so these yellow texts are basically part of the script that happens in the film. So these are the sort of the foundational questions that I was also trying to ask myself in the research process. So on the right is actually Vesalius' image drawing, and then on the left is a meridian channel drawing. So we have heard both about both extensively at this point. So I won't speak too much about them anymore. But the book on the top right, the expressiveness of the body, is essentially a very influential book in history of science that really showed me not only the key differences between Chinese medicine and Western medicine systems, but also doing that through comparing the visual traditions. This is also a moment for me when I realized, oh, there's actually so much knowledge contained in even how images get made. And how things are portrayed, right? Like human bodies can get portrayed in such different ways when you see them through different layers, different worldviews, and then you kind of see different things conceptually from human bodies. And of course, we also saw this earlier today. I was really interested in kind of this particular set of drawings from Vesalius's anatomical drawings because in my research, I learned about how it got translated into China through this German missionary in like in 16th century, about 16th century to early 17th century. So what actually happens there is not only that obviously the line, the mark making changes significantly, but also that he added these annotations that are more related to sort of the Chinese calendrical system instead of like the common kind of like anatomical, probably like labelings that would happen around then in the West. And that image on the right got seen by this Chinese painter in about a century later or 2 centuries later in the 18th century, Luo Ping, who was basically doing his ethnography around ghosts. He was looking for visual inspirations for portraying ghosts, and he saw this translated manuscript, and he was like, well, that looks like a ghost to me, so I'm going to paint that into the painting. And I thought this moment was really interesting, so I also staged it in my film with the kind of the main character in my film, this very exquisite ornamental skeleton robot almost. And I was really thinking a lot about how, to me, this moment of sort of almost a bit of like a misunderstanding of what was really happening with the visual material that this painter saw, where he didn't really take it as an anatomical intention, but anatomical purpose, but actually used it for portraying ghosts for not a serious purpose at all. I thought it was really beautiful because I think that this happens all the time. It's still happening today. And this is actually often when really interesting cultural artifacts kind of come about. So I decided to play around with that in my film as well, while also using it as an entry point to kind of talk about like what is really happening with what was really happening for a very long time until maybe nowadays, maybe like about a century ago, where like knowledge transfer really happened through such like a small set of humans that would travel really, really far with their very particular agenda. And then somehow this is how we learn about, different cultures learn about each other's knowledge making. People didn't have the internet. We didn't have really crazy transportation system for a long time. So yeah, and then this is also like, I try to basically work some of the archival research materials into the actual 3D environment as well. So the drawing, the translated manuscript drawing is also like in the background in this frame. And then also, as mentioned by one of the talks earlier, like Qi specifically is such an interesting term and concept where it really eludes translation into English and into the kind of more established knowledge system we have today as science. We really don't know how to translate Qi and like how to really explain what it is. And so I really kind of honed in on that in my own script and my own story in the film as well. And basically, at this point, what was happening in the film is the narrator, he embarks on his he embarks on his trip from Beijing to Paris, the center of enlightenment in the late 18th century.
I must visit the other end of the world.
So this is one of the two excerpts I'll show. But basically, I can go on forever. I don't have the time right now. But a lot of the elements of the ship itself were elements, like research elements, essentially, like drawings that I came across in the archive online of like Meridian Channel manuscripts or like chinoiserie elements and things like that. But yeah. Oh, yeah. Oh, wait. Okay. Yeah. This is an example of this Meridian image becoming the ship sail in my film. And then entering the second half of the film, you go into the second walnut essentially. And now you're basically, this is like, the narrator is basically speaking about his experience in Paris, where he meets, all of the scientists, who were essentially establishing some of the foundational values of modern science. And this is like really where I kind of go deeper into the question of like what really makes qi, like a concept like qi, but also like Chinese medicine, but then also the kind of philosophical the philosophy and the cosmology behind that, undergirding all of that, what really makes that illegible to what we know as science today. So something that came across to me that was really interesting in this research was mesmerism. It was basically this physician who kind of claimed that he discovered this magnetic fluid that is behind, that is contained within like everything in the world. And he basically claimed that he could perform healing sessions for people where they would feel energetic changes and shifts, which got debunked as essentially like pseudoscience, as like not rigorous by, a bunch of the more kind of like emerging establishment of science in France. But what was really interesting was that there were a lot of really well-connected, influential people in France at the time who took this not only very seriously, but also thought that this might be related to what Chinese Taoism was about. So I turned the instrument used by this guy to perform his healing session, which is the wooden thing on the left. I turned it into a spider. I basically modeled it in the 3D software, but give it different textures and then give it bones and made it move like a spider. And so inside this film, at this point, he basically the spider Baquette is basically walking around and transforming the spirit of every science instrument in the entire walnut. Actually, I'm gonna skip this slide. But yeah, there's like magic lantern. There's like basically a show. The backdrop is that what is happening in this walnut is that there's a show happening, and there's like another object also becomes a monster, and it's like on the it's a kind of like a projector essentially, and then so on the slide for the projector of this monster, instead of playing like what usually would be ghosts in back then, like for these entertainment performances in France, instead of like ghosts, it's actually images from that were from these like translated manuscripts about like Chinese kung fu. Yeah, like that. And then these sort of spiders. And then at some point towards the end, you're heading into space. You're all of a sudden transformed into space, and the skeletons are performing Tai Chi on like a giant cosmological instrument.
Matter conserves, Tao returns. They are of the same cycle. Nothing is lost, but only transformed. Between crucibles and meridians flows the same breath of the cosmos.
Okay, very short, but that's a little bit of yeah, I think this is like this was the hardest part for me to sort of design or imagine even for myself. This is the very last scene that I made for the film, I'm pretty sure. Precisely because what I wanted to do in this film is not really just kind of like showing you like what happened, but also suggesting something potentially new. But then what is that new thing? Like what would it look like? I didn't really know, and I didn't want to be like prescriptive either, because I'm just an artist after all. So what I ended up doing was I thought a lot about like, okay, what did I really learn from the research process I was doing, learning about what were the values that were being established during Enlightenment for scientists. And a lot of that was kind of these these sort of like sensibilities really, as sort of explained by some of the authors I was reading, sensibilities around kind of like really like almost like taking a step away from your own senses, but actually delegating your judgment and your perception to external instruments and giving them nomenclatures, giving them measurements and quantifications as a way of pursuing rigor and precision. And that is all of that is fundamentally not what Chinese medicine is about, as you know we heard about earlier. So what was really happening here is that actually the ghost of enlightenment is embodied knowledge. It's also correlative thinking, and it's a lot of these sort of values that were de-emphasized or deemed as almost counterproductive in knowledge making, that for a lot of us we don't necessarily think is true. And so I really kind of took the time to reflect on that in this portion of the film through the narration. And visually speaking, I was really inspired by giant astronomical instruments I saw in Beijing. And I thought about how maybe measurement in this new world that I want to envision would be, there still would be a measurement, but it also would be almost interactive. Maybe it is some kind of like, instead of like some kind of pure objectivity that is outside of our bodily senses, it would be something that would feel almost like inner objective, whatever that would mean. So then that's why I had the ghost performing Tai Chi on these giant instruments. Okay, yeah, I should have showed that earlier. But this is a script. I'm gonna skip this. And then towards the very end, basically the book, A Global Enlightenment, kind of kicked off all of the research for me and for this project. I was really just obsessed with this book for a long time. And it kind of focused on this one missionary, Amiot, who went from Paris to Beijing and ended up staying in Beijing for the rest of his life. He actually kind of plotted kind of like a secret society that would join Eastern wisdom with Western knowledge discovery, like into one knowledge system. I don't remember what it's called, but he basically was kind of scheming that in his journal. And I thought that was so inspiring. And so I wanted to kind of make up something like that on my own as well. And another thing that's related. So actually the specific scientist I was studying in Paris, the specific scientist in Paris I was studying for this project is called Antoine Lavoisier. He basically is considered father of modern chemistry. He was very instrumental in basically defining the nomenclature system for chemistry. He like named oxygen basically. And there's this very famous kind of portrait of him and his wife in their laboratory. So I basically took this image and I used AI to kind of imagine like other figures in my like pseudo history that would be performing some kind of bodily exercises that are also experiments, essentially in science, whatever that would mean or like whatever that would be called. And I basically turned them into giant paintings in this virtual environment as if you are in some very crazy, important building in Paris. But it's my imaginary history, essentially. And then this is the very last line of my film, Whose Palm Cradled My Dreams, because everything happens in two walnuts, right? And which is this imagery that kind of came to my mind before I knew anything about what would happen in this film. I just like, one day I just kind of thought, oh, I want to have two walnuts floating in the sky in this film. And I didn't really know why. But then I thought about how in China, like it's like a kind of like a sort of a literate's hobby to kind of like have two walnuts like in your palm and then you rotate them. It's something that so that you polish the walnuts to have like better textures, but then that also activates your meridian points on your hands, which are basically like, this is like very much like there's like so much happening on your hands basically. So it's like very good for your body. I thought that was really interesting because I don't think I want to just make a point in this film about just like China and France in 1780s, which is what it's nominally about. But I was more interested in talking about like, okay, so this is sort of my point of entry into this bigger topic of translation between knowledge economies, universes of, epistemic universes. But like what really is like kind of like how were these differences even created in the first place? That is a question that I never had an answer for, but actually want to invite people to think about. So this is how I decided to end the film. Whose palm cradled my dreams? Outside of the walnuts, like what are the walnuts? Where are the walnuts? Yeah. So yeah, that is the ending of the film. And like I think a history of science really in some way is a history of errors. It's a history of failures. It's a history of selves that fear their own subjectivity and try to seek some kind of truth outside of their body. And it's also a history of just kind of a lot of individuals trying to make sense of what is happening in their interfacing with whatever is perceived as outside of them, but it's also really in them. And so I'm and obviously, as we can see, like earlier today, so much about our knowledge about the body has been conveyed through visual medium, as diagrams, as drawings, whatever they're called. And fundamentally, as an artist, I just make images, right? Either they move or they don't, or they're interactive as games. And so I also thought that like actually making art for me is in some way a way of tinkering with how knowledge gets transferred and translated and communicated. So this is my experiment with kind of communicating some research and questions I had for a long time. Yeah. Thank you so much.
Hello, good afternoon. Thank you so much for being here, and also ArtScience Museum for giving me this opportunity to share this project. So 8 years ago, this is me 8 years ago, and I was invited by Singapore Art Museum for the President's Young Talent Program to do an exhibition. And I was a young artist at the time, and I remember being very nervous because I'm trained in classical drawing, hand-drawn animation, and continental philosophy. Everything that I learn is very slow. So, making a show in a short amount of time was a scary thing. And I remember I met a senior artist, I think he's here somewhere today, Ang Song Lian, and I had told him that I was feeling very nervous about filling up a space. And he said, if you have a big space to fill, then pick the smallest story you have to fill it. And so at that time, I thought to myself, the smallest story that I was keen to tell and was interested to tell was a story about keloids. So keloids are kind of benign dermal tumor, and it has a strong genetic predisposition. So my keloid's on my chest. So 8 years ago, it looked like that. 8 years later, it's quite different now. It runs in families, and there's a higher prevalence on populations with darker skin tones. And also you find it in communities in Africa and Asia and Hispanic populations and many more. Now, the cultural conversations over keloids have been framed mostly as a medical disorder. Or you can be described as some shameful aesthetic defect, a cultural imprint, an autograph of social skin, a warning indigenous practice of scarification, a beauty choice perhaps, or a warrior's pride. And in all the instances where it's been observed, we see different ways of speaking about the keloid. But the existence of keloid scars have been acknowledged as early as 3000 BC by the Edward Smith's papyrus, and when he was describing the Egyptian medical practices. So the keloid in Greek, if you look at it etymologically, it means the crab's claw. And it's because keloid scars, unlike normal scars, so if you have a wound and you have a scar process, it situates itself on the site of the wound. But if you have the keloid gene, what happens with your scar is that it will continue to grow beyond the site of the wound. So across my 20 years of having this keloid scar, it has crawled across my skin. And many of my cousins have it, my aunts have it. It runs in the family. And so this is something that is quite common in Singapore. If you see people on the streets wearing sleeveless outfits, you might sometimes see it on their arm because of the BCG injection that they had when they were younger. And so that's what the keloid is. But we rarely really talked about it. And when I was growing up, I didn't really know the name of this scar that I had. I just knew I had a scar. And the only thing people tell me about it is how to get rid of it. So in 2018, when I was given this opportunity to tell this story, the first thing I wanted to do was to do a portrait of my own scar. But given my background in classical drawing felt insufficient. And so thus I started to look for different ways to present a portrait of a scar. The other thing that I wanted to touch on, which was a very tender point about, a lot of keloid scar, people with keloid scars, is the way people talk about our scars. So this was my grandma, who doesn't have the keloid gene. And she once told me that with this scar, this mark, I'll be identifiable as a corpse. And, this is it's pretty harsh. She's the 1950s Cantonese grandma, so you can imagine. But it was also quite interesting to think of scars as a form of identifier, but also the way we sort of think about what it means for our family to have a scar that is part of the gene. So in the end, in my search for finding a way to present a portrait of my scar, I happened to be at a friend's steel factory. Her family runs a steel factory that makes giant ventilators for buildings. And while most of the times when you use welding, you're using it to bind sheets of metal, and you sort of sand it down so that you don't see the seam. But when you have all these raw forms of steel bits that are just everywhere around you, I realized that they look a lot like keloid scars. And also keloids themselves are it's a skin. It's your skin on skin. So a steel weld on steel surface made a lot of conceptual sense for me. So I went to learn how to weld. And in that sense, started to think a lot about what it means to draw via welding and to draw a scar and to create a scar on a smooth surface. So then I also started to think about what it means to have this keloid scar, and I started to talk to my family members in a very different way. I asked them what it felt like to grow up with a keloid scar. I asked them what it meant for them to have this. And they would share very kind of personal and vulnerable stories with me, like my cousin who, the moment he started developing keloid scars on his back, quit swimming, and he decided to never swim in his life again because he never wanted people to ask him what this was all about. And so in this slow process of chatting with them, I started to make keloid scar drawings, weldings, or drawings, as you call it, of my family members, and recording the little things that they said that I remembered about the way they described their scars. What was also interesting to me is that in their process of describing these scars, some of them are in places that you don't see. They could describe in extreme detail. And when I asked them, can you draw, do you know how to draw your scar? They could all draw it in perfect detail. So there's this interesting familiarity with the scar that we have that is embedded in our memories. Even if they're not in a site where we can see it, it's almost like a trace that's traced by a hand, when you touch a part of you and you're able to describe it visually. So I made 10 of these keloid scar portraits from different family members. And the other part of me was also my role as an artist, taking something very private and intimate and vulnerable and putting it in a public space like a museum, and what it meant for me to carry these stories. I thought about the idea of telling stories as a bit of storytelling as lying, or storytelling as embellishment, and thinking about what it means to gild or to gold leaf these scars and to present it in a different way, to make it look valuable, to make it look beautiful, to make it look different. Now, another thing that I didn't mention was these sheets of steel are mild steel, so they would rust over time. And like skin, they change by the environment, by the conditions. They're not stainless steel. So in the combination of all my thoughts, I decided that I needed to put myself out there beyond just putting the scars, but to put my body as a kind of vessel to carry the scars of my family. So these are the works that you would see downstairs at the exhibition. There are 5 panels on display where I'm carrying the scar portraits of my family on me. And this one is particularly special to me because this is my cousin's scar after she gave birth to her daughter, my niece. And it formed a keloid, And she was very generously sharing it with me about how, what she felt, what it reminds her of, the process of labor, the things that her body had to do to repair itself. And also it's kind of an externalized symbol of the life that she created. So in the original exhibition at Singapore Art Museum, and this was at 8Q, so 8 Queen Street, it was set in a place that was extremely dark. So when you entered the room, these drawings were placed far away, and they almost felt like ghosts sort of floating in darkness. and you had to kind of encounter them one at a time, at a distance. And each of these scar portraits came with a few lines of text, sort of from the voices of my family members. And in particular, I would only talk about the one on the left. It says, "I feel very self-conscious, inferior. I hid it like an ostrich. If no one sees, no one asks." So things like these. In the final room, because there's kind of like told in a very classical plot, the three-act structure. On the last act, you encounter this room full of wall text. It was a reflection that I had written thinking about what scars were, that, the idea that wounds are gaps of forgetting, so scars grow as reminders, and that, our skin that's all over us, inside us as well as outside us, and all these reflections that I had, learning about a scar that I grew up with, that I didn't have a name for it until this point. And it was really, really coincidental, because this same year when it was presented in 2019, there was a news article that came out on Straits Times about this doctor at the National Skin Center called Dr. Tae Hong Liang. And he had invented a different delivery system for the steroid that's often used to treat keloid scars. And I'm using all these quotations because it's not really a treatment for keloid scars. It only sort of slows down or mitigate the growth process of the scar. But he had a friend whose child, who's probably maybe 6 or 7 at the time, developing a keloid scar on her face. And the traditional way of injecting, steroids into keloids is a huge needle, and it's extremely painful and scary. And it wasn't a wise thing to do with a child. So he invented these microneedle patches in order to change the way this medication was delivered. So I ended up meeting him because of the exhibition, and became his research subject for a few years. So it was a very interesting connection that happened. But then this project was so intimate and so personal that at the end of the exhibition and this cycle, I stopped working on it because I didn't really have anything else to say. I wanted to do a family portrait, and I did. And so that was it. It was only until 2014 or early, midway 2014 or 2024. But early on in 2023, I was invited by the Institutum to have a dialogue with an African artist for their upcoming show called Translations Afro-Asia Poetics. And so I met this Nigerian artist called Yifeyinwa Chiamonwu, and they had put us together because they thought 2 charcoal artists from across the world would have something to talk about. But we ended up bonding over keloids because she has keloids too. And she shared with me, her family, how they saw keloids was that this is a warrior's pride. This is the life experience put on display. And they would do scarifications because that's the way they can identify each other, whether they're from the same tribe far away. And I was telling her, here, it's a medical condition. We are very embarrassed by it. We're trying to hide it all the time. We only talk about it in terms of a pathology, a kind of illness. And so I thought it was really interesting to think about the way we tell stories about scars and how scars are a form of language and how it's transferred from person to person and also across cultures and across time. And I decided to turn that wall text that you saw in the first exhibition into these slips. I wrote the whole thing out on these 62 mild steeled panels. I bound it together like an old Chinese scroll, and then I displayed it like that. And so the text is obscure. You can't actually read it, even though it was formed from words. But then now scars become almost a visual symbol of a story that has been passed on, and now you have to interpret in your own way. So these are our works put side by side. There's a charcoal drawing of her friend with 2 keloid scars above her breasts, and then my scroll and another drawing with a woman's back and a series of keloid scars on her back that are gilded, but they are shaped like the Southeast Asian islands, a little bit sort of echoing the idea of the things we carry on our backs. This project also found interesting life along the way. at the end of 2024, there's a performance artist called Sonia Kwek who I've worked with for years, because at that point I've been teaching life drawing and surface anatomy in universities for 10 years. And she was one of the models that I worked with quite often. And we were doing a project for National Gallery. And they wanted us to respond to the room with the artist Pinari Sampitak, whose work is also downstairs, as well as Raja Shariman's like metal sculptures. And so in that process of developing how we could respond to works inside a gallery, she and I was developing a project on the way we remember childhood discipline and rattan canes being part of the materials that I was investigating. She put on the rattan corset that I made and asked if she could wear the steel panels as like kind of a visualization of the weight that we carry on our bodies and the things we need to shed. And then these metal slips that you see, they are really heavy. They're about 60 kilos in total. And so she was wearing this and moving in the gallery space and responding to the pieces around her and taking on their shapes, but also turning away. And eventually at the end of the session, the audience members who were there, they helped remove each of these panels and formed a bridge on the ground. And we talked about how these works translate to their experience, how their scars inform the understanding of how this work could be in an artistic space. And the last thing I want to share in this thread of scar works is most recent. I was invited, these works are currently on display in Malta and Valletta, concurrent with the Malta Biennale. I was invited by an artist called Vince Briefer, who is curating a show called For Want of Not Measuring, querying our relationship with measurements and systems and the way we use systems or reject systems. And in light of that, I decided to make a series of small A4 size grid etchings, like metal etchings. These are on stainless steel. And some of you might recognize some of these grid lines and lines. You know, one is a music sheet. The other one is when we learn mathematics, we draw with graph papers. So these are systems that we've been taught how to learn things, systems of knowledge in Singapore, whether it's about writing in English and Chinese and Tamil and Malay, whether it is about, you know, the way we understand music and math. And on it, I started to write words of prohibition, things like do not trespass, stop, do not go here in multiple languages. And these words then get welded over, slightly obscuring it. I titled these pieces, We Do Not Scar Within Set Boundaries, because we only learn through mistakes, you know, no matter what systems are set up. And so if we do not scar and we do not learn, then, you know, how would we have stories to tell? So yeah, that's it. Thank you so much.
Maybe I'll just start with some thank yous. Before I go into my presentation, I would like to extend my heartfelt gratitude to the Getty and the ArtScience Museum for this opportunity to share this work within such a relevant context surrounding human anatomy. And thank you to the independent curator, Teng, for bringing my work to the table, and my fellow artist, Yanyun, whose work about keloid scars sits perfectly across mine, and to have this very important dialogue about scars on our bodies. I'd also like to give a shout out to local independent and art spaces and initiatives that nurture photographers, image makers, and storytellers in Singapore. DEC, Objectives, and the Book Show. Thank you. I'm grateful to the participants and the authorist, Dr. Nigel Tan, who gave their trust in sharing their experiences and threading vulnerabilities with me. Thank you. Rules for photographing a scoliotic patient is only possible because of an entire village that supported it, and so it is very precious for the work to be part of this moment right here at ArtScience. The presentation in the gallery is a careful selection made by the ArtScience curators, and I'm very happy to be given this chance to share a fuller breadth of the project with everyone here. May I trouble Song Nian to help me pass around browsing copies of 2 books that I will reference later. Feel free to browse as I continue to tell this story in a more chronological order. Thanks, Song. I would like to set some context regarding scoliosis. Scoliosis is a spinal deformity where the spine starts abnormally curving sideways. There are different types of scoliosis, and this project specifically looks at adolescent idiopathic scoliosis that often occurs in children between 10 to 18, especially during ages of puberty, where rapid growth can quicken the progression of the curvature. While it is often asymptomatic, it causes uneven shoulders and asymmetrical waist. It is more common in girls than in boys, with a ratio of 7:1. And according to an article in 2024 put out by Sing Health, in cases where the curve exceeds 30 degrees, the female to male ratio becomes 10:1. And that's where I sit in because my curvature was about 40, over 40 when I got my surgery done. In Singapore, it is likely that we have a higher detection rate given an annual school-based screening is conducted. So I was diagnosed with scoliosis in primary 5 through such a health screening in school. Nurses and doctors would show up once a year to set up their stations demarcated by medical privacy screens. And class by class, we would queue in line for examinations. And for one particular examination, we would be asked to remove our top and our bralettes, bend forward, and hold that position while the doctor measures, observes, and scribbled his notes. The humps in my back were uneven, and a letter was sent to my parents, and that set me on a journey with scoliosis and the medical institutions in Singapore. At the hospital, the doctor recommended bracing, but my parents and I were uncertain about the cold, hard brace that I would have had to wear for up to 22 hours a day, only taking them off to shower. And so we opted for TCM instead, but that was the start of another type of nightmare. Imagine needles the length of a finger twisting in your body, or hearing the cracking sound of your bones when a chiropractor attempts to nudge your bone back into where it's meant to be. And in the end, the curvature still progressed in a disapproving manner, and the doctor suggested that we should go with a spinal fusion surgery, which took place in 2007 when I was 13. So over here, you'll see an X-ray taken right before my surgery and an X-ray taken 10 years later when I was 24, I believe, with the implants in my body. So it has been about 2 decades, and I imagine my spine now is inseparable with these titanium implants. Referencing back to what Eleanor was sharing earlier about the black box theory, I would be that open black box in that case. Fast forward to university, I majored in photography and grew up as an image maker. One of my earliest image-based works is Ways to Tie Trees, shot between 2015 and 2016. Back then, I looked to the immediate environment for inspiration, the garden city whose nature I have never really paid attention to. For some reason, I was drawn to trees that were staked around the neighborhoods. There was something about the theatricality, the artificiality, the rigidity, and also a little bit of that care within it. And taking walks around Singapore with an analog camera over there in the corner, a tripod and a white backdrop, this process of making the work became a way to see Singapore with a renewed appreciation and awareness about all these manicured streets with young trees transplanted from nurseries, and also the invisible labor of migrant workers who work for landscaping companies in Singapore and the tension between man-made and natural. By a stroke of luck, through an open call organized by DEC, the work was selected to be published by a photo book publisher in Germany, Steidl, in 2018. And here's what my younger self wrote about the work then. There are many creative permutations in the field of tree staking. This is a crucial component in beautifying our garden city. Nature plays an important role in constructing a productive living environment for the human race. As part of urban planning, trees are uprooted and erected in organized intervals along roads or in open public spaces. Through this process, man-made objects serve as necessary reinforcements to stabilize trees. Tree staking, like our innate human instinct to control, is ubiquitous yet goes largely unnoticed. At the end of 2018, I visited Wellcome Collection in London by chance. And wondering about the library at the top floor, I thought what would be the most relevant topic I could look into. And given Wellcome's intersection between art, science, and medicine, scoliosis came to mind. And so I encountered all these various medical books within the same library. One of the book cover features an illustration of a tree with a curved trunk bounded to an upright stake. It was based on a symposium held in London in 1979, perhaps similar to the one that we're in today, but with majority participants being Western male physicians. Imagine the shivers that literally went down my spine when the dots connected. It turns out that tree staking has been used as an analogy to visualize the intervention of scoliosis in human bodies. The gaze I casted upon the trees in the earlier photo series was in fact a gaze back at my own body. And this chance encounter with the medical books about scoliosis stirred many thoughts and emotions in me. Another poignant discovery was this text in a book by Samuel Kleinberg in 1951. It lays out a set of rules for photographing a scoliotic patient, suggesting how and where the patient should stand, the manner in which the subject should be lighted, and how shadows and movement should be reduced in order to create a standard photographic record of scoliosis. All these affected me as an image maker who happens to have scoliosis, and so upon my return to Singapore, I felt a need to make sense of these images I found in the medical archive. Taking the photographs out of the context of medical books and juxtaposing them to form new connections, many questions started arising. Who are these people? Where are they photographed? Do they know that they are being photographed? How long did it take for these images to be taken? And how are they feeling, both physically and emotionally? As an Asian woman living with scoliosis in a different century, I wanted to create new images that are counter to the approach of the Western medical photographers and physicians who documented and circulated these images. In 2021, with the support of the Objectives Documentary Award, I started working with individuals with scoliosis. I put out an open call through a Facebook community called Scoliosis Support Group, and to my surprise, received quite a few keen interests. We would hop onto Zoom meetings, and that's where I got to share my intentions and the 3 activities that I hope to carry out with them in their personal bedrooms. 1, to make portraits of their back. 2, to document videos of their back in movement. And 3, to have a conversation that was recorded and later turned into a transcript. During the photo shoot, wherever possible and when tech is cooperative, I would offer an iPad with a synced view so that they can also see what I'm seeing behind the camera. We would discuss the level of nudity that they are comfortable with, as well as the type of poses that they want to try out. And I also invited the participant to scroll through the pictures on the camera and delete any as they wish. So the gaze is not one way, and it is a shared collaborative one. Concurrently, the project was being developed into a photo book supported by an initiative called A Different Reading by the Book Show, where a designer was paired with a visual artist to collaborate in making a book. I worked with the very talented Macarius Eng, whose beautiful layout you will see in the next 2 slides. We decided to include the transcripts of 10 conversations as a companion booklet to the images. The sit-down conversations was important, and I would always begin with the question, when did you find out you have scoliosis? Because that marks the start of the journey with this condition. Having a chat was the way in which I bonded with each participant on a human level, where we learned about how similar or different our lived experiences were growing up with scoliosis. We spoke about pain, decision-making or the lack of, about our scars, body image, childbearing, about how our implants might look when our bodies get cremated, about bracing, invisibility, financial struggles, identity, and anything under the sky. In a way, this was a common space where we articulated and processed what we and our bodies went through. One comment from Cheryl was particularly striking. I can't see the back of my body in full view, and I've always wanted to see it. All the thoughts that happen in my mind and insecurities, do they translate into something that is real? Looking at it, is it obvious? I'm quite surprised. I look pretty normal, not that bad. And I was reminded by a poignant scene in the movie Yi by Taiwanese-American filmmaker Edward Yang. In that scene, the little boy said, "Daddy, you can't see what I see, and I can't see what you see. So how can I know what you see?" And the dad replied, "Good question. I never thought of that. That's why we need a camera. Do you want one to play with?" And the little boy replied, "Daddy, can we only know half of a truth?" And in puzzlement, the father responded, "What? I don't get it." And the boy goes on to explain, "I can only see what's in front, not what's behind. So I can only know half of the truth, right?" For most participants, this was the first time seeing their back, and photography in this case was able to show them a more complete version of their reality. The way they see their bodies is no longer limited to medical x-rays or the mirror. And the last conversation I had reflected in the booklet was with a local orthotist who is a medical professional who designs and makes assistive devices such as insoles and braces in the case of scoliosis. The orthotist 3D captures the body of a patient, makes calculated adjustments on a software, puts in an order for a foam mold to be created, and then thermoforms rigid plastic over it to create the Boston brace. This foam body made of polyurethane becomes trash once the brace is made, and so I became the trash collector. I collected them back to my studio and photographed them individually, not as if they were medical objects, but as imprints of people who were very real. No 2 molds were the same, and the result was a set of images where every human trunk speaks a different volume, and every curve carries different weight. There are many ways to see the same thing, and this is how art sees differently from science or medicine. It's been a challenge to give a TLDR for this project, but let me attempt. In summary, rules for photographing a scoliotic patient, which borrows the name from the earlier text, is an attempt to create visibility for the condition of scoliosis, centering upon the unique lived experiences of individuals, and offers a counter-narrative to science in understanding this condition. I believe that art can contribute in challenging the medical gaze beyond just a diagnosis to form nuanced portraits of individuals, and also to create collaborative spaces where both vulnerability and strength can be celebrated and seen, and that art can also be a critical approach in representing human health conditions as an inspiration to our lives and identities, not just a problem to be solved. And lastly, it is my biggest hope that this work will bring comfort to and resonate with the many girls and boys who will find out that they have scoliosis and feel a little less alone and intimidated by it. Thank you.
Thank you so much, Wendi, Yanyun, Sok, Chiharu, for a series of powerful and deeply affecting presentations that are not just representations of the body, but also representations of ways that we can be with the body. And I'd like to start with the idea of what it means to work after anatomy as a space that opens up when its limits are felt. And perhaps I'll get the first question to Wendi. And Wendi, your work constructs a speculative encounter between Taoist philosophy and Enlightenment science. And these are two systems that historically, they might not have fully converged. They originated thousands of years apart in different parts of the world, like you shared, and they were driven by completely different intellectual motivations as well. Yet in your work, they are sort of coexisting. When you do this, are you trying to translate between these systems, or are you trying to hold them in tension?
That's a really cool question. I feel like I think I want to imagine something that harmonizes both in a way where like both can exist rightfully and they like complement each other. That's my goal. But of course that was really hard to imagine. And then so it became a lot more like kind of like philosophically hypothesizing and having more metaphorical imageries to go along with them. But I do feel like I think sometimes when I think the word translation here is the key, because it really is about translation of like, okay, what is actually contained in behind like the words and the images and the methods and the techniques and everything that get used. And to translate that properly requires way more than just trying to find a right word equivalent of something in another language. And I think with new technologies happening, maybe there will be tools and techniques and whatever methodologies that we will kind of come up with new technologies that will be able to actually translate, I think, some of the foundational ideas behind what traditional Chinese medicine actually like in practice does and has been doing for a long time. I think that is super possible. I don't know what that looks like, but I'm hopeful.
And Chiharu, thank you for opening up such an intimate philosophical space with your talk and moving through the trajectory of your works. Well, your work is not speculative in the same narrative sense as Wendi's. It proposes another kind of knowledge of the body, one that's felt and lived through, where the body is both material, but also it's something that exceeds materiality. And I have a question for you in terms of the materials that you use. They are often very simple materials like keys and thread, shoes, very everyday objects. What draws you to these materials when you work with very complex emotions, oftentimes your own, but also sometimes of others?
私が使う材料についてでその中には鍵であれば新しい鍵を集めることはなくてその古い鍵を集めていてその中には必ず人の記憶があるその靴でも新しい靴を集めるのではなくてその古い靴を集めてその人が使っていた思い出とか物語を書いてもらったりしてその存在そこのその物自体のオーナー持ってた人の 会ったことはないんですけども、その記憶をたどることによって、その人があたかも存在しているような気持ちになる。で、そこを赤い糸で編んでいく仕事、記憶を紡ぐ仕事をしています。
So it's not the materials themselves that's key, but the key is that I only use, whether it's keys or shoes, I never use new ones. They're not new. These are old keys that I collect, the keys that belong to someone else, shoes that belong to someone else. Because when these things are new, there's nothing there. There's no memory. There's no one present behind those items. But old keys, old shoes, they hold memory. Someone was there. Someone was wearing them. Someone used those keys. So by using those, these old items, I collect the memories of all these people I've never met, but I know that they were present. And then with the red string, I tie all those memories together to form like a collective memory.
And Chiharu, I wanted to take the opportunity to ask you about your works, which are very often shaped directly in the sites where they are presented as well. When do you feel like the works are complete? Is it when, I guess, the process of the experience of creating them kind of feels resolved in your own body, or something else?
わかります。いつ終わりかっていう。もともと絵画なので、その赤い糸を使っていても、絵を描いて終わりに似ていて、空間にドローイングを描いていて、空間に絵を描いている状態で、線を引くことに、3次元に絵を描いていて、で、その絵が終わりっていうのを視覚的に、これは終わるっていうのが、自分の中で体でも視覚的にも分かります。
So as I mentioned before, I specialized in painting when I was studying in art schools, and the string artwork is the same concept. I'm drawing, but in space, and so I'm creating almost like a 3-dimensional drawing. So I just know visually, and also that basically I just know visually when it's done. It's the same concept. Like when I'm drawing, I know when the drawing is done. It's just that it's not on the canvas. It's using space. But when it's done, it's done. I know it.
Thank you. And I'd love to share a question with Yanyun. In Chiharu's work, we hear about the body and the self as something that can expand or dissolve or lose its boundaries. But your work, there is a sense of different kind of movement where the experience stays and it persists in the body as mark and trace. And your scars extend beyond the surface of the skin to hold time and memory in a way that is visible, but also it can be quite elusive. How do you think about what remains in the body after an experience or an event, whether it's emotional or whether it's physical, and is making that visible a sort of translation as well, or a form of preservation or something else for you?
I think the fun thing about memories is that every time you remember it, you're actually making it again. And so in the recalling, you're actually recreating memories constantly. And I think there's something, when one experiences something, the way we tell the stories to ourselves, it shifts. It's never the same. And each time you're given the opportunity to change the way you tell the story. I think it parallels a little bit with, it parallels and also goes against a little bit how keloids are, because I cannot control how my keloid grows. It has a life of its own, it's doing its own thing, and it will decide to start and stop whenever it wants. And there's literally nothing I can do. So it's a site where it will change constantly throughout my life, and it is on my body, and it's changing my body just like time does. But it's one that I have to admit defeat and complete surrender to this thing that I have and allow it to happen. But I think what's interesting about memory is that I can do something about it. I can't change the fact that something happened before, but I can change the way the story is told each time I get to tell it. So I think there is those two things happening when one thinks of a trace or a mark that's left in the body. There's going to be portions of it that you can't do anything about, but there are things that you can. Yeah.
And so thank you for pointing to that wonderful dialogue with Yanyun's work. Your work traces a different kind of documentation through medical imaging, photography, and personal archives, and each one carries its own way of seeing. I'm wondering how you think about the space between these, like between images that are produced to classify and correct, and also images that are made to reclaim or maybe re-narrate the lived experience. And in that space, do you feel like you are able to step outside the medical gaze, or do you have to always sort of move in relation to it?
I think as an artist and an image maker, I'm free of the objectivity of science and medicine. And I feel like there's this freedom to make images that are not meant for examination. So in relation to that, with the collaborators, we were really free to think out of the box. I mean, if you look at any of the images, some of them you may not even be able to tell that this person has scoliosis because it's just so nuanced. But I think it's the process of making that image, the intentions of how we want to make it, that shifts from how the medical images were being made. And so I think having this privilege to make with all that freedom and having that in dialogue with archive and older images from science just opens up that conversation a little bit and let people be able to understand the condition from different point of views. I'm not saying that, medical images are not important. I think they are, but just the kind of space and care that maybe art allows more for.
Thank you, and would love to find out whether you might have any questions for the artists who are on the second panel. If you do, please raise your hand, and my colleagues will come pass you a mic. We have a question from Honor on the side. Thank you.
Thank you all for such incredible presentations that have helped, I think, articulate what we were trying to draw out in the exhibition so beautifully. So there was a moment when we were installing the show where you showed us this image that you had seen in the Wellcome collection of the 18th century illustration of the tree tying that sent shivers down my spine because the previous time that we had collaborated with Suk was showing the tree tying work in an exhibition that we staged during the pandemic called Margins. And I remember at the time we were talking a lot about that practice being about, this desire to tame nature and the unseen labor around it. Nothing to do with your own, medical condition at all. I just wonder if you could speak a little bit about how it felt when you discovered that this tree tying practice had been associated with the exact condition that you had for centuries without your knowledge up until that point?
It was really serendipitous. I was really just in pure surprise. But it really changed the way I related to the work that I made myself. And right now, whenever I look at ways to tie trees, it almost feels like a different version of me has made it. And if I were to make the same work again, it would probably look different with this new knowledge. But also with that fact of finding out that historical timeline, when that analogy was first made versus when I first made ways to tie trees, it just propelled me to want to connect the dots. Yeah. So thank you for that question.
Thank you, Honor. Do we have another question from the audience? Thank you. That's Akin at the back.
Hi, thank you so much. This is for Chiharu-san. So I apologize in advance if this might be a bit personal. So my mother also had cancer, and when she passed away towards the end of her life, I felt like she had changed quite a lot. And I'm wondering for you, if you, as you're going through these challenging times, whether the art that you make also helps to ground you and give you a sense of identity and remembering your emotions and who you are. I hope that makes sense.
「そう、答え難しいです。多分両方だと思います。自分自身あまりにも幸せだと作品が作れなくなってしまうんじゃないかっていう。で、作品が作れなくなってしまったらもっと不安になってしまうっていうのもあって。でも、恐怖も病気もすべて避けるというか、作品を作るのに自分には必要なもので、病気になるたびに自分のアイデンティティをもっともっとなんか見えてくるような気がして、そういうところ。
You asked a very difficult question, and I'm not sure if this answers your question directly, but yeah, in a sense, I feel like, if life is good, you have nothing to worry about. I feel like I won't be able to create good work. So, and then that's a fear in itself. Like, would I be able to create great work if everything is happy-go-lucky? So in a sense, it's not that I wish to be sick. It's not I wish cancer to befall on me. But now looking back, I realized that this illness kind of revealed a lot about myself that I didn't know. And that led to the works that you saw in my presentation. So in a sense, I needed this, but it's not something that, I can easily say that, I wish it on myself or on anyone to get sick so they can create something better. So it's very complex.
Thank you, Kin. Do we have another question from the audience? It might be the last one that we can take. Anna.
Thank you so much for that. I think all of the presentations were just so insightful, and I really felt like so much for all the works that you presented. I think this question is mainly for Yanyun and Sok as well, because I feel like some concepts that you explore within your work are so highly intimate, and in many ways you are also very brave in sort of coming forward to speak about these different things, who I guess for a lot of people that may be very new for them. And because your works are so collaborative and also bringing in individuals like yourself who also have similar experiences to yours, were there any sort of stories or interactions and encounters that you had with these individuals in which they kind of felt almost like inspired by how much you wanted to open up about what you were trying to explore, and whether you could share anything through those encounters and conversations as well?
So for mine, because these are family members, so we grew up together, all my cousins, and everyone's older than me. So it was not a very formal sit down, I'm making an artwork, I'm talking about this. I think when I was chatting with them, I had no idea what I was doing. I was just curious what they felt having the scars, because I had it too, and wanted to talk about it, not in a way of how do I get rid of this, but rather what is it like, having this, and what are the feelings that they had when they were 15, when they started developing. And so I learned a lot about my family members, but there was already a lot of trust, So the conversations were casual, over a coffee or chit chat, and they had no idea, to be honest, what I was going to make with it. And so there's a lot of trust, right? And I will always remember this moment, which I shared about my cousin who decided to quit swimming the moment he started developing keloids. He came to see the exhibition. Actually, all of them came to see the exhibition eventually. But I remember he went to see the show, and I had prepped to say, oh, this is what I did, and, have a look. And then he came out crying because he's like, this is the first time I'm seeing my scars because it's on my back. But now it's in front, and it is in a space like a museum alongside all the other scars of the other family members, some of which he has seen and some he hasn't, and all their voices up, and mine as well. And so he was really, he was like, I'm emotional thinking about it because both of us were very emotional at the time. And I think because I saw him and he shared that with me after the exhibition, I was like, I guess this is what I want to do, And it gave me the anchor of why I do art in the first place. So it was the start of all the family stories that I write about and make works on. But it was that moment, I think. Yeah. Thank you for the question. So,
I think to the point about trust, the trust that you get from a family member is probably a little bit different from a trust that you get from a stranger, because most of the participants in my project, I would have met them for the first time in their personal bedrooms. And then for them to then go on to remove their clothes and, be in front of the camera with me, I think that took a lot of courage from them. And I felt that I also had to be equally vulnerable in the sense that when we sit down for that conversation, we really bear our journeys. Nothing was taboo. Whatever we were comfortable talking about was all there. And that became a very cathartic process because we realized that a lot of us don't actually talk about it because we were so young when it happened. And at 13, you're probably trying to get on with life and forget about whatever that you have gone through. And so that each session was really precious. And in fact, I feel like they taught me more than I have done anything for them, because they showed that everyone's experience is so unique. There's no one person that went through it the same way. Yeah, and I think as the work got shown in various manners and in different spaces, there were even more people that will come up and say, thank you for making this work. I have scoliosis too. And to different levels, like some of them have gone through a surgery, some of them have found out through a health checkup, or some of them it's like, I think I might have scoliosis. And I think just the fact that people came up and said, I have it and you have it, that moment is really precious because scoliosis is a condition that's so invisible. If I didn't talk about it, or if any of them didn't tell me that they have it, we wouldn't have known. And I think, thank you for that question.
Thank you, Anna. And maybe just a closing question for all of you. We're just inspired a little bit about by how Chiharu mentioned in her talk, how the body is something that may dissolve into memory, into matter, maybe into the universe as well. And also her questioning where the self begins and ends. Across all their works, the notion of the body is something that changes, it breaks apart, and it might continue beyond itself. And I was wondering whether you might like to share how has your practice changed, or if it had changed at all, how you experience your own body in everyday life, or how you understand your relationship to it in some way.
Okay. Definitely, I think so, because I feel like initially, like I feel like for me, my artistic interests can come from intellectual passions that I don't know where to expend that energy other than into some kind of art making. And I feel like working on this project, but also some other projects, really made me come to see how porous our body really is, and in terms of mediating how we even make sense of the world at all, and how we even design things in the world, whether they are instruments of science or they are other types of technological modifications. And so the way that at the same time, like, so much of what we even know about our body, like, it's so dependent on the technologies that are available to let us literally see things. Like, one of my favorite images of all time is this thing called Photo 51, which is the first image that humans made of the DNA double helix structure, and that was the evidence, that was a proof, that was used as the proof for essentially validating the double helix theory, and then allowed the scientists to win the Nobel Prize right after. And I think about that a lot because it's sort of like we as this kind of like I don't know, container, what feels like a container, biological container, the way that we come to see what even this is so dependent on like all the things that we somehow have like learned to make and like to mitigate our vision, and then that changes our language and our metaphors and like mental imagery, and that in itself is like a channel. And so I feel like in my own daily lives I think about that a lot. It's sort of like, yeah, I don't know where my body starts in some way, I don't know where my body ends either, like just conceptually speaking. Yeah.
I think there's a quote that lives rent free in my mind forever. There's a French philosopher called Jean-Luc Nancy, and he writes about the skin of images. But he also talks about the skin as an interface of two universes, the outside universe and the inside universe, that is constantly putting pressure on each other. And your skin just happens to be right in the middle. And sometimes they get punctured, sometimes things move through, and sometimes things move out. And so the idea that the image is a skin that has worlds colliding and pressing on each other, I feel like that is how I perceive the bodies, like my body now as well, and the stories that I want to tell. It's just there is an interior world that is pushing out against the world that's pushing in. And I'm just trying to find a language for that.
Expanding on that thought about the inside and outside, my practice used to seek a lot of inspiration from the external environment, the nature and artificial or not. And I think increasingly that concept of what nature is has been extending inwards. So really considering our human body as part of nature, and how we also often seek to control and intervene this nature that we inhabit, as well as how that sort of feeling of, being further and further and further away from what biologically we are meant to be or we're told to be, and how our mind and our body always has this sort of dissonance, and how we can navigate through the distance. Yeah.
私も制作をしていて死に直面して人が死ぬっていうことが頭だけがなくなるってことではなくて体全体がなくなっていくことだってことをよく考えるようになりました。
So for me, as I was creating all my artwork, and so there came a point where I was diagnosed with cancer, so I was confronting death. And then when I started thinking about what does that really mean for the body, I thought, death is not just about the loss of your mind or your cognitive functions, but death really means the disappearance of your entire body. So yeah, just a different way of thinking about what happens to the body in death. And I don't know if it's answering your question directly, but that's how I see the body now.
Thank you so much for your talks and this very profound set of reflections. What we've tried to do in the program is to try to move between systems that seek to define the body and practices that remind us of everything that exceeds those definitions. And we hope that what stays with you is not perhaps a clearer image of the body, but a more attentive way of encountering it. And we are so grateful for the team that made this gathering possible. First of all, to our speakers for their depth and their generosity. Honor for opening the day with care. Mamiko for your interpretation, and the exhibition's co-curator, Jerome, who's really the one that kind of brought all of us together. And the many wonderful heads, hands, and hearts behind the scenes. We have Joreen, who is the lead producer of the symposium, my colleague Charmaine, who has been helping to look after everyone at the front of house, and also our wonderful technical collaborators, Keith and Fadila. They are wonderful because the batteries drop for the mics, and it's not their responsibility at all. It's just a technical glitch. And thank you so much to all of you in the audience for holding the space so thoughtfully. We hope you carry some of these reflections with you as you spend time with Flesh and Bones exhibition, and perhaps also as you move through your own encounters with bodies. Please join me in thanking our final panel of speakers, Chiharu, Yanyun, Wendi, and Mamiko on interpretation. And we hope you have a wonderful weekend.